Hello.
हेलो, ये इंट्रोडक्शन दिया का सर? हेलो.
येस स्टार्ट करा सर.
Okay sir, thank you. Good morning to all. I am Dr. Suryanshi Dhammapal Nyandev, working as assistant professor in chemistry at Shri Chhatrapati Shivaji College, Umarga. In a 13th faculty induction program sponsored by UGC Malviya Mission Teacher Training Center, Dr. Babasaheb Ambedkar Maratha University, Chhatrapati Sambhajinagar. Today, I am going to give the introduction of today's research person, Dr. Sachin Shivling Bhusari. Dr. Bhusari sir done his M Pharma from BITS Pilani. Sir done PhD from BITS Pilani and also PDCR in clinical research. Hmm. Presently, Dr. Bhusari sir is working as an assistant professor at UGC Dr. Babasaheb Ambedkar Maratha University, Chhatrapati Sambhajinagar since September 2009 to till date. Hmm. He is head center for DMPK studies, UGC Dr. Babasaheb Ambedkar Maratha University, Chhatrapati Sambhajinagar. Hmm. Dr. Sir Bhusari sir's research area is preclinical drug development from ancient systems of medicines. Also, analytical and bioanalytical method development, HPLC, LCMS, EMS, GCMS, MS. Also, pharmacokinetic studies in preclinical and clinical. Also, formulations and biochemical assay development. Dr. Sachin Bhusari sir also got patent. Uh, Out of these, three patents are granted and one is failed. The Dr. Bhusari sir's publication is that Bhusari sir has published a total 85 research papers in international and national journals. Also, Dr. Sir Bhusari sir has published one book chapter. Contact and research projects of Dr. Bhusari sir are as industrial. There are 5 projects: Alchem, Philosophes, Fibrac, Severa, and Indichem. Out of these, 2 are government. FDA Forensic Science Department, Chhatrapati Sambhajinagar. Hmm. The research also Dr. Bhusari sir granted some research 0.68 crores. CSI DBT research project 19.13 lakhs. UGC major research project 11.74 lakhs. And DST project is 24 lakhs. The proportional data of the proportional recognition awards and fellowships of Dr. Bhusari sir are as recipient of National Facility for Bioanalysis, recipient of DST Fast Track Scheme for Young Scientists, recipient of Senior Research Fellowship of CSR Government of India, also gold medalist and stood first in merit list of B Form, best outgoing student and stood first merit list of D Form. Dr. Bhusari sir, proportional positions here is as follows. He is a member of Innovation Incubation Linkage, Dr. Bamu Chhatrapati Sambhajinagar. He is member of Research and Recognition Committee, Dr. Bamu Chhatrapati Sambhajinagar. He is also chairman of ADHO Adolf Board Herbal Technology, Dr. Babasaheb Ambedkar Maratha University, Chhatrapati Sambhajinagar. He is member of Adolf Board Department of Chemical Technology, Dr. Bamu Chhatrapati Sambhajinagar. He is member of Adolf Board Pharmacy, Dr. Bamu Chhatrapati Sambhajinagar. Member of Departmental Research Committee, UGC, Dr. Bamu Chhatrapati Sambhajinagar. Member of Research Advisory Committee, UGC, GCOP, Dr. Bamu Chhatrapati Sambhajinagar. He is also member of Research Advisory Committee, Ved Prakash Patil, Pharmacy College, Chhatrapati Sambhajinagar. This is about the biography of Dr. Sachin Bhusar, sir. Thank you, sir.
Hello, am I audible?
Yes, sir.
Yes, sir.
Yeah.
Thank you. Thank you very much for your nice introduction. Good words for me. Thank you very much. Dear participants, so now let us start with today's session. So first of all, I would like to offer my sincere thanks to Madan Mohan Malviya Teachers Training Program, HRDC, formerly HRDC of Dr. Babasaheb Ambedkar Marathwada University, Aurangabad. The director of this HRDC, I am thankful to him for giving me an opportunity. Of course, Dr. Rafi sir is good friend of mine. Thank you, Rafi sir, and his entire team. So let us start with today's session, series lectures of two. So dear participants, the first lecture and the second lecture, it's an interconnected lecture. So in first lecture, we'll be having overview of human health. And in human health, definitely there will be an, hello, hello. Yes. So for first lecture, definitely there will be an integrative understanding about the human health, and it is a constructive presentation which will give you the insights about human health and how the aspects of the human health has been changed from past to future. So my first lecture will cover this about human health. It's a general lecture, but definitely it will be very good for you people to get the idea and to know something about our own health. Okay, so this is about the first lecture, and definitely in second lecture we'll be having a discussion about IPR, intellectual property rights. So both the lectures are interconnected. So be with me and listen carefully. Whenever you have some doubts, you can ask me the questions in between session also, or else we can take the question session at the end also. It's up to you people. So let us start with today's first lecture. स्लाइड चेंज होत नाही वाटतं बघ स्लाइड स्लाइड काय झाली बस ओके थँक यू so for today's presentation, so this is the scope of the presentation. So we'll be having insights about the health, then health issues. Now the next part of this will be stages of diseases. So there are two approaches. Basically, we do practice allopathy as well as the Ayurveda in our country. So these are the two major pathies which we actually follow. We as a Indian. So stages of diseases as per Ayurveda. So how Ayurveda look towards these diseases and what are the stages? Definitely stages of diseases as per allopathy. We're going to see both the things. Then next comes the diagnostic methods. So how to diagnose basically if something goes wrong with the health. So there should be some proper mechanism of diagnosing the ill health. So diagnostic methods which are followed by Ayurveda as well as diagnostic methods that are followed by allopathy. So it's an integrative approach. That's why I have coupled both Ayurveda as well as allopathy. Intermittently, there will be references of homeopathy also. Okay. So next to that, we'll have detailed discussion about the diagnostic methods. Then we'll see some diagnostic tests and its interpretations. So definitely this is one of the important part of presentation wherein you would find some of the key diagnostic tests, their results, actually standard values and its interpretation. If something goes wrong above and below values, so what is its meaning? So this is for our understanding as well as for implications in day-to-day life. Then next to that, I have purposely included point of care testing devices. So nowadays, all we are using some small equipments at our home place to just diagnose, to identify if something goes wrong. So point of care, that is technical term, POC testing. It is called POC testing devices. So I have included the details of POC testing devices also. Now, beyond that, we'll look towards the drugs, API, active pharmaceutical ingredient. In technical word, API, active pharmaceutical ingredient. So then in that we'll see sources of the drugs and more importantly, the process of drug discovery and development. How these drugs are developed, basically what is the way by which it is discovered and it is developed. Because right now we are using the ready-made drugs which are available in the market. So what is the history of that? How it has been developed? So we are going to see that also. Process of drug discovery and development. Now, beyond that, I have included advances in drug discovery and development also. So one must know the recent advances in these processes. As we look for the mobile, as we look for the vehicles, what are the advanced features? So in similar way, there are advances in drug discovery and development also. So I have included that advances in this drug discovery development presentation. Now, beyond that, we'll see future of drug discovery. What is the future of drug discovery? And at the end, we'll conclude this session by a summary, wherein total summary of the presentation will be there. So now, first of all, let us discuss about the health. In modern era, we all are health conscious and ambitious to keep our health at the good level. But the important part is, what is the meaning of health? How to define the health? For today's scenario, if we talk about health, you just talk to your friends. You will find that everyone is saying, I am fit because I can run 2 kilometers. I can run for 1 kilometer or 3 kilometers. Somebody may tell you, I can go for bicycling or cycling for 2 kilometers, 5 kilometers. So I am fit. Somebody may say, I am a good swimmer, so I am fit. So fitness, health, these are the contemporary, you can say, terminologies. So we generally talk about fitness. Health is a broader aspects of the fitness. So fitness definitions are different, health definitions are different. So now it becomes necessary that what is the meaning of health? So now health, WHO, World Health Organization. See, all over the globe, there is only single organization which governs this health. Okay, governing principles are given by this agency, World Health Organization. It is a cocktail of all the countries, members of all the countries. Okay, so it's a World Health Organization. So as per WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it is a combination of physical, mental, and social well-being. Well-being, good one, good at the certain good level. So you should be good at physical, mental, and social level. If you look back to our ancient literature, Ayurveda, so Ayurveda explains the health in a more broader manner. So what is that? Good health is a state of equilibrium of the three doshas, Vata, Pitta, Kapha. So these are the three doshas. So it's an equilibrium state of Vata, Pitta, Kapha, where the mind and all organs of the body work in harmony and the person enjoys peace, happiness, and performs his her duty of life with comfort and ease. So it's a broader definition of health wherein Ayurveda has rightly pointed out the doshas, the balancing of the doshas, and how these doshas are impacting the organs. So we should be able to keep our organs at the balanced level. Okay, so this is as per Ayurveda. Now the third one, which is again very important as far as Indian scenario is concerned, that is called naturopathy. We do practice naturopathy every time. We all basically, willingly, unwillingly, you can say, or intentionally, unintentionally, you say, but our basic setup is such that we do follow naturopathy. How? So how naturopathy look towards the health? See, in naturopathy, basically, it is something like balancing of five elements of the body, Pancha Mahabhut, Pancha Mahabhute. So what are these five elements? You can see very well in the picture. It's a fire, wood, earth, water, metal. Huh? Agni, Vayu, Jal, Akash, Prithvi. Okay. So these are the five elements. So we consider that our body is made up of these five elements. Not considered, basically it is proven also. So no issue at all. So five elements that guides the body are normal or are in harmony. And if a body is functioning according to the constructive principles of the nature. So that is the classical definition of the health as per the naturopathy. And one more pathy, we generally look towards this pathy that is called homeopathy. So we do have a central council for research in homeopathy, same in Ayurveda, same in Unani. So Homeopathy says health is considered as mental, physical, and emotional well-being. Okay, so again, there are three important components: mental, physical, and emotional well-being. So clear? So health can be defined by various ways, but these are the classical ways by which you can define the health and you can understand the health. So now, again, question comes in mind, sir, for individual level, it is easy to understand about the health. What about the population? What about the community? By and large community. How do I say my community or my Aurangabad, Chhatrapati Sambhajinagar is healthy in nature? My state, Maharashtra state is healthy in nature. My country, India, is healthy in nature. So there are some health indicators. Indicators, these are the points, these are the highlighters which actually tells us about health. So there are 10 classical health indicators. You can see the slide. So first indicator is life expectancy at birth. Second is infant mortality rate. Third is neonatal mortality rate. Fourth is maternal mortality ratio. Fifth is mortality from serious diseases. Sixth is cancer incidences, diabetes incidences, depression incidences, disability adjusted life years, and activities of daily living. Okay, you can see the reference line also. So by using these 10 indicators, you can calculate the overall health of the population. Population is not one person. It is by and large the community. You can say region, you can say area. Okay. So few of them I can explain health indicators. So maternal mortality ratio. So number of women who die due to pregnancy or birth complications per 1 lakh births in a year. So we can calculate the maternal mortality ratio. That should be as minimal as possible. Ideally, it should be zero. We are now towards the developed country, so that should be almost zero, but it won't happen, unfortunately it won't happen. So maternal mortality ratio, so that ratio, if it is too low, then yes, our population is quite healthy. Similarly, neonatal mortality rate, so number of newborn deaths. So there are two terminologies, basically infant, neonatal. So by and large, you should be able to understand what is the neonat. Neonat means the baby who is having the age 1 to 28 days, less than 1 month. So it comes under neonatal. For infant, this age bracket is 0 to 1 year. Okay, these are the terminologies. Those who belong to pharmacy, those who belong to medicine, they can easily understand. And yes, of course, we should all should know about this neonates and infants. So children's under 28 days, children under 28 days. So death, number of death of newborn babies. So that also signifies the indicators. As an indicator, it acts as an indicator for the population health. Okay. So number of cancer incidences, number of diabetes incidences. Do you know, in India, if you look to us right now, towards the scenario, we are in red zone of diabetes as well as the cancer, because there are so many cases nearer to us, wherein you will find the cancer incidences as well as diabetes incidences. So that means if you talk about the cancer incidence and diabetes incidence, so by using these both indicators, we do not belong to healthy population as far as cancer and diabetes is concerned. Even third major issue is depression also. Okay, so these are the indicators which overall defines the population health. So now next to that is your health issues. So in health issues, now up till this point, we were trying to understand what is the health and how to define the good health of the population. So now it's time to decide or discuss about the health issues. You or me, anybody else in the world, we do suffer a lot somewhere at our health level. So what are the health issues in general? Okay. So while talking about the health issues, there are three different terminologies which we do explain or we do express or we do use, that is disease, disorder, and syndrome. So while using these terminologies, so we should be able to understand the clear-cut demarcation between these three. Disease is what, where the underlying reason is known. Okay, skin disease. I know this is the skin disease because of the fungal infection. So root cause is known. Then it is called disease. In disorders, unfortunately, root cause is not known. mental disorder. Just take an example, mental disorder. We know there is something wrong at my mental health, but I don't know why it is there. So it is called disorder. It is not mental disease. It is mental disorder, correct? And third is syndrome. So in syndrome, when you call any particular thing as a syndrome, so syndrome is something which have more than one disorder, and the underlying causes are not known. Okay, so it is called syndrome, Crohn's syndrome, where the disorders are more than one, which are included there. Okay, so while using this terminology, you should be very careful about disease, disorder, and syndromes. Now, next part of health. So, at what level there are issues? At what level there are issues? We do consider health issues at our physical level only. So that means organs, bones, and muscles only. If something goes wrong with bones, muscles, organs, so we feel that I'm not healthy. Something is wrong with my health. But that is only one aspect. You can see in picture, health is something like combination of physical health, mental health, and social health. Okay. So when you talk about health issues, so it is not only about the physical issues, okay, physical health. It is about mental health also, it is about social health also. In mental health issues, there are issues like anxiety, depression, and stress. Anxiety, excitation. Depression, you are feeling low. And stress, you are always in stress. So normal day-to-day activities, you cannot perform with joy. Okay, so stress is there. And third part of your our health is social health. See, you can see so many friends around you. Some friends of yours may have very good communication skill and they have very good touch with everybody. Some of your friends may not have that kind of depth in the relations. It's because of the health issues, social health issues. So in social health, what are the quotients of the social health? Societal integration, friendships, even relations. So we must have good social integration, friendships, and relations. If something goes wrong with this, then definitely it is an indication that your social health is not well. There is some issue with the social health. Am I right? So let us go to next part. Now, after understanding this health, now it's time to understand the disease progression in the human body. So disease progression can be understood by two different ways. One is like allopathy, which is a modern medicine system, and one way of understanding the disease progression is something like from Ayurveda, homeopathy. So it's an integration. So I am going to explain both. So before going for Ayurveda, first of all, one must have understanding about what is human body as per Ayurveda. What Ayurveda says about human body. Okay. So if you look towards the human body from the Ayurveda perspective. So Ayurveda says it's a combination of 7 different uh, uh, components. Components, you can say Sapta Dhatu. Sapta 7. Dhatus, tissue. Tissue is a terminology from the modern medicine system. But yes, if you want to convert Sapta Dhatu in the English, says definitely 7 tissues. So what are those? Rasa, Rakta, Masa, Meda, Asthi, Majja, and Shukra. So its picture is self-explanatory. Rasa, fluid, rasa. Then Rakta, blood, yes. Masa, muscles. Meda, connective tissues, fat, Meda. Asti, yes, definitely everyone knows it's a Sanskrit. So bone, Majja, bone marrow, and Shukra, reproductive system. Okay. So Ayurveda says that our human body is made up of Sapta Dhatus, and there is perfect balance between these Sapta Dhatus. Okay. So human body is made up of these Sapta Dhatus. So this is baseline of Ayurveda. Whenever you study human body, so this is the concept which is very well explained as per Ayurveda. So now, see. So now, what are the stages of disease in Ayurveda as per Ayurveda? So Ayurvedic thinking. Okay. So now, in this Sapta Dhatu, it's a combination of all these. So there are some called, you can say, dosha, three dosh. So dosh, vata, pitta, kapha. So vata, pitta, kapha. These are the three doshas as far as Ayurveda is concerned. Yeah, I know everyone knows these terminologies. I'm just trying to correlate this with modern system of medicine. I do belong to modern system, fortunately or unfortunately, it's by both the ways. But yes, and I'm trying to integrate both modern medicine system as well as our ancient system of medicine. So that we can have clear cut understanding. So as far as Ayurveda is concerned, so there is three dosh, vata, pitta, kapha, and imbalance between this dosha, vata, pitta, kapha, leads to disease. This is the concept. So now it becomes necessary, sir, you are talking about vata, pitta, kapha. So where it lies basically? A layman may ask this question, sir, vata, pitta, kapha, we know by terminologies, but where it resides basically? So it is called home seat for vata, pitta, kapha. So if you talk about kapha, so a person may, without knowing the details, may say that kapha, it's upper respiratory tract, say it's cough, which comes in the mouth. It's a we expel that. So it is not like the concept. Basically, kapha. Kapha is, it's a connective tissue basically, and the home seat for kapha is bones, muscles, and tendons. So it binds the body. It is kind of adhesive. It is an adhesive in the body, kapha. So that means what? Although it belongs to one vikar, the dosh basically, three dosh, but it is an inherent part of body. It's a home seat for kapha is bones, muscles, and tendons. Now let us talk about pitta. So everyone knows pitta. We do suffer from acidity and all those. So we know, sir, pitta dhalale, I'm feeling uncomfortable. So the home seat for pitta may be stomach. Yes, definitely. Small intestine, stomach, liver, spleen, gallbladder, blood, sweat glands, subcutaneous fat, eyes, and skin. These are the classical home seats of pitta. Not only stomach. Can you imagine? So see, this is a home seat. And for vata, the home seat is lower body, lower part of the body, below abdomen. It's a colon, pelvis, pelvic organs, beside thighs, skin, ears, nervous system, and lungs. Okay. So these three doshas, there is imbalancing between these three dosha and delocalization of these three doshas. They leave the home seat. And how it happens? So first, it's an accumulation.
रिझल्ट लागला नाही ना सेकंड इयर फर्स्ट
कुणाचा तरी स्पीकर चालू आहे, थोडंसं स्पीकर म्यूट करा. पार्टिसिपंट्स 5 नंबर स्पीकर बंद करा.
तेच विचारायला आलो होते आता तर तोपर्यंत त्यांचा टाइम टेबल करावा.
रोल नंबर 5. Thank you. So first there is accumulation. It gets accumulated somewhere. There is aggravation. The ratio or the quantum of that dosha with vata, pitta, kapha, it increases quantitatively. And because of this quantitative aggravation, it gets disseminated. So there is a distribution. Again, it leaves that particular location and it goes to some other part of the body, and there it gets localized. After that, it gets expressing that at that location. That is called manifestation. And beyond that, again, there is chronicity, disruption, where these three doshas shows its effect. You can see, if you sit for some more time, so you will find that you are getting that vat at your legs, lower leg. So you always call it payala vatala if something goes wrong. So this is how it is. Basically, vata, pitta, kapha, these are the three doshas. And there is a stage from accumulation, aggravation, dissemination, localization, manifestation. It leads to chronicity and disruption. Okay. So as far as Ayurveda is concerned, if you want to understand the progression of the disease, so these are the various stages through which there is a development of the disease in the body. Okay, so you can see the reference also. Now, what our modern system of medicine says about the stages of the diseases. Okay. Ayurveda talks about Saptadhatu and three doshas. What about the modern medicine system? In modern medicine system, it is more specific rather and quantifiable. So you can quantify it, you can see it, you can judge it, you can have proofs. So I will try to explain. I will try to explain this stages of disease as per allopathy by taking one example: coronavirus. Okay, so in 2020 we all suffered a lot because of this pandemic, corona. Okay, so that now this is a coronavirus. It was a virus basically. So I'm not going to get into that debate whether it was natural or man-made. So everyone knows what was the story of that corona, but it acted as a stimulus. Definitely, it is external stimulus. Okay. Sometimes our body parts itself act as a stimulus for developing a disease. Another classical example is arthritis. Arthritis is basically immunological disorder wherein our own antibodies actually antigens produces antibodies against our own tissues, and there is degradation of your what you can say joints. Okay, so that in that case stimulus is internal. Something like corona, stimulus is external. So stimulus may be internal, may be external. It actually alters the biochemical processes in the body. Our whole body is based on biochemical reaction. Do you know? In our body, it's a chemical factory, basically biochemical factory. Our biological system is there, chemicals are also there, and there is a combination of biology as well as chemical. That's a biochemical factory. So this stimulus alters the biochemical processes in the body. So net effect leads to change in anatomical and physiological structures, or basically you can say anatomical structures or physiological processes. So there are changes in anatomy as well as physiology. So for you people, I would like to say anatomy, that means the structures of the body, tissues, organs, muscles, and all those. And physiological changes, the processes, production of the cough, production of the what you can say acid in your stomach. So it alters. Hey, see, simple. If you take something very heavy food at the night, yesterday night, so today morning you may suffer a lot because of the acidity. So what is the triggering point? The triggering point is a food that is also external stimuli and which enhance the acidity level in the body. Okay, so there are anatomical as well as physiological and or physiological changes, and it leads to discomfort, and the slowly progress in that discomfort leads to symptoms. And by observing that symptom, now we can understand, yes, there is something wrong in our body, so we have to correct it. Okay, so while understanding the stages of disease as per allopathy, so this is a general procedural part where you can see the stimulus integrates, actually triggers the biochemical process alteration. That biochemical process alteration triggers the anatomical and or physiological changes, which leads to discomfort and symptoms. So now clear? So as per as Ayurvedic is concerned, there are three doshas, and as far as allopathy is concerned, the stimulus may be internal, may be external, which alters this normal functioning of the body, which leads to symptoms. Now, after this part, the next topic starts that yes, if something is wrong in my wrong with my health, if I am having some health issues, so now I understand how these diseases are getting triggered. Now the question comes in mind, sir, what are the ways by which I can actually identify ill health? How to identify? So that comes under diagnostics. This is a classical terminology. This is not conventional, basically unconventional. You can say modern terminology, diagnostics. So previously also diagnostics was there. Okay. So now what was that? Again, I am going to show you. I am going to talk about this also. So this slide explains very well. So what are the diagnostic methods as per as Ayurveda is concerned. So in Ayurveda, so that is called Trivid Pariksha. Trivid Pariksha. Pariksha. Nidan. Okay. Examination. Correct word. Not Nidan is diagnostics, but Pariksha is examination. Examination. Okay. So Trivid Pariksha. So there are three classical ways by which you can diagnose a patient as far as Ayurveda is concerned. So first and the foremost is darshan, left and lower side. First one, darshan. So just by observing physical body, physically, if you observe somebody, so you can identify if something is wrong. See, classical example is if you are suffering from neck pain, so your friends will catch you like anything. They will catch up. Yes, something is wrong with your neck. How? How come? Because while turning, you are not moving your neck. Now you are turning your whole body. So somebody who is very close to you, he or she will understand. Are there is something wrong in neck region. So darshana, got the point. So in Trivid Pariksha, the one classical way of examination is darshan. Second is prashna. Prashna. So what is that? You can ask. Hey, you let me know the symptoms. What is happening to you? So you can ask the questions to the patient and you can get the information. So second way of diagnostics in Ayurveda also, it is a prashna. Here I would like to emphasize more on prashna. Another pathy which has a core, this prashna as a core is called homeopathy. You go to any homeopathy doctor, you will find that these homeopathy doctors will ask you every minute details. Why and how? The reason being, if you want to understand the background of the patient, you must ask the questions. That is one way, straight away, one way to get the information. But that information becomes vital if you collect very minute details. Something like, yes, you are suffering from headache. Yes, sir, I am suffering from headache. So what you ate yesterday night? So you can give the answers and he will note it down. So prashna is core part of homeopathy also. Although it belongs to Ayurveda also, but homeopathy will have more emphasis on prashna. Okay. So in Trivid Pariksha, darshana and prashna. These are the two ways by which you can diagnose the patient. And the third is sparshana. Sparshan. In technical word, sparshan. Sparsha. Touch. Touch. Okay. So Trivid Pariksha. So darshana, prashna and sparshana. So let us have, so you can see it's a classical data from International Journal of Phytopharmacy. So good one, 2015 paper is there. So in my presentation, you will find the references. You can take out the references, you can dig out the references and you can go through the details. So my aspect is to give you the idea to integrate the knowledge from Ayurveda and modern medicine and to let you know how to track your health issues, what are the solutions for that, and how you should proceed. Okay. So now next, in Ayurveda, Ashtavid Pariksha is considered for classical consideration. Ashtavid Pariksha. Ashta, 8, different 8. So 8 types of different examinations. So Nadi Pariksha. We all know there are some Ayurveda Charyas. Very famous Ayurveda Charyas are there in India. Just they can they touch, they go for Nadi Pariksha and they will let you know about your history also. So this kind of Nadi Pariksha Ayurveda Charyas are available. So I come across one classical information I would like to share. There is one person near to Dahegao Bangla. He is an Ayurvedic doctor, but he is having a very classical hand of Nadi Pariksha. I don't know his name. I don't know who is he. I haven't met that fellow, but I came to know that he is a very good Ayurvedacharya who is having a very sound knowledge of Nadi Pariksha. So pulse examination is the classical terminology for that. So Jiva Pariksha is another tongue examination. Shabda Pariksha, voice examination. Sparsh Pariksha, skin examination. Drak Pariksha, Drak eye examination. Akruti Pariksha, general appearance. Mudra Pariksha and Mala Pariksha. So Ashtavid Pariksha is well described in Ayurveda. If you want to diagnose a person who is suffering, so you can have Nadi Pariksha, Jiva, Shabda, Sparsha, Drak, Akruti, Mutra, and Mala Pariksha. So if you try to correlate this, we do have this kind of technologies in modern medicine also, because modern medicine is, I personally feel, my statement may be very bold, but my understanding is modern medicine system is based on this ancient knowledge, maybe from India, maybe from outside India. So this modern medicine system is having this backbone also. We do have Mutra Pariksha, Mala Pariksha in our modern medicines also, stool examination, urine examination. Beyond that, we do have blood examination. Okay. But if you keenly observe, in Ayurveda, all the diagnostic methods are non-invasive, non-invasive. There you don't harm the body. And that is the best part of Ayurveda. You must have a sound knowledge in such a way that by using this Ashtavik Pariksha, you should be able to diagnose the person properly, diagnose the patient properly. And this is missing in modern medicine system. Now we do have for everything, we try to take out the blood sample. It's an invasive technique. Okay, that is mandatory. Of course, we do have very different kind of diseases also right now. So yes, it is mandatory, but it is invasive in nature. Okay. So now, diagnostic methods as per as allopathy is concerned. So it starts with cellular and chemical analysis. Now I am talking about the allopathy. In allopathy, how we diagnose basically. So diagnostic methods are based on analysis, cellular and chemical analysis. At cell level and chemical level, we analyze the substances, blood samples, urine samples, fecal matter, saliva, sputum, bile, sweat. You take any biological matrices, we have ability to analyze that. Okay. In my next presentation also, I am going to share some of the high-end facilities which are available in my laboratory, where we do do cellular and
सर
chemical
आले
analysis.
तिकडे आणि आम्हाला कशाला बोलवलं?
Participants, कुणाचा तरी mic चालू आहे, please थोडंसं mute करा. Okay, so next part is diagnostic imaging. Diagnostic imaging. So we take a help of imaging system also. In allopathy, so X-ray technology. What is that? MRI. I'm going to discuss that also. So diagnostic imaging is there. Then genetic testing is new domain which has been launched last 10-15 years. It gained more importance as far as testing is concerned. Genetic testing. So we do have measurements also, and physical as well as visual examination is again an integral part of allopathy also. So genetic testing, newborn screening. Okay. So in newborns, we can take out the samples and we can screen that samples, and we can judge whether this newborn is going to suffer of any, you can say, diseases in near future or not. So newborn screening is there. Even prenatal screening is also there. Dr. Shubhangi Bhosle. Dr. Shubhangi Bhosle, mic mute करा.
चुकून झालं म्हणून सांगायचं. काय बोलायचं? ऐकून घ्यायला माहिती. काय बघा?
अवघड आहे. Physical and visual examination is also part of allopathy. So now, if you talk about diagnostic methods in detail, so you can see cellular and chemical analysis, amniocentesis is there, blood analysis is there, gastric fluid analysis, kidney function test, liver function test, that is called KFT, LFT. These are the classical ways to call that test. We can get the cellular and chemical analysis for even pregnancy. Pregnancy prenatal testing is also there. Thoracentesis is also there. Toxicology testing, urine analysis is there. Uroscopy is also there. So I would like to talk about centesis. So centesis is something like you puncture the body, you take out some fluid. So that is called centesis. Amniocentesis, you can take out the amniotic fluid. Okay. Amniocentesis. Centesis is for puncturing the biological system and taking out some fluid for the treatment. Thoracentesis. Yes. Thoracic cavity. You are puncturing that thoracic cavity and you are taking the sample for the analysis. Okay. So some of the common terminologies everyone must understood. Now, as far as diagnostic imaging is concerned, we do have MRI screening. Ultrasound, USG is well known, very well known to everybody. Ultrasound. ultrasonography or sonography. You can simply say sonography. MRI screening is there. CT scan is there. So cholecystography is there. Echocardiography is there. Angiography is one of the prominent techniques nowadays we are using for the diagnostic purposes. It comes under imaging. So got the point. So in diagnostic imaging, yes, diagnostic images are helping us to identify, say, if you are suffering from any coronary diseases, coronary artery diseases. So angiography is one of the classical way of finding out the coronary diseases. Even brain scanning is there. Okay. Cholecystography, echocardiography. So next part of this diagnostic method details is genetic testing, measurements, and physical and visual examination. So see, in genetic testing, complementation tests are there, fluorescence in situ hybridization, and pre-implantation genetic diagnosis. I would like to say something about this genetic testing, wherein now genetic mapping is quite possible. You can map your genome for your parent identification, your children identification. Okay, so these are the kind of tests which are available for under the genetic testing. Even we can take out some biological samples and we can try to find out whether in near future we are going to suffer a lot because of some chronic disease or not. So that is also quite possible by using a study of RNA DNA. Participants might
नाही केलं ना चालू म्यूट कसं झाला कुठे चालू आहे ना एक आवाज
okay. So measurement. When measurement is concerned, there are so many tests. Semen analysis is there. Pulmonary function test is there. I would like to talk about this pulmonary function test. If you are suffering from asthma, so if you go to doctor and to treat your asthma, first of all, he will try to find out your lung capacity. So he will try to he or she will let you know, sir, just aspirate the air in this balloon. Try to burst the balloon by your mouth, and he will try to find out your lung capacity. Okay, so these are the functional tests which comes under measurement. Okay, lumbar puncture is there. Oh, phonocardiography is there. Electrocardiography is there. Now the last part, physical and visual examination. Physical and visual examination. So in this, I would like to talk about 3 to 4 different tests. When you say autopsy, if you want to find out the reasoning for the death, so you can have autopsy. If you are trying to find out the anatomical changes, so you can go for biopsy. Biopsy is the test which is executed or done on the living body. Okay, autopsy is for dead body. Okay, so try to use the correct terminology, autopsy or biopsy. So skin tests are there, patch test, sick test, and tuberculin test is there. Then uroscopy is also there. Okay, so there are so many tests wherein you have a direct physical or visual examination. Endoscopy is one of the technique wherein if you are suffering from any stomach disorder, disease, or if the disease is related to your small intestine, especially stomach. Okay, so there we do have endoscopy technique. So wherein a binocular is basically passed through your oral cavity up to stomach level, and stomach is examined physically. See the classical way of examining the stomach. So that comes under endoscopy, wherein you can try to see or you can find out any anatomical changes at your stomach level. Okay, so that comes under physical and visual examination. Now diagnostic test and its interpretations. In diagnostic test and interpretations, I'm not going to read every test. Okay, so we do have only half an hour for left for this session. So I would like to, if time permits, again I will explain, no issue. But for this point of time, we'll be having a very short visit of this test. So in allopathy, clear-cut diagnostic tests are prescribed. Now question comes in mind that basically standard values are based on what? who describes the standard values. See, everybody should have that logical thinking. So for India, in India, the highest authority for us is ICMR, Indian Council of Medical Research. Okay, so we do have a council for medical research, and ICMR is the highest authority as far as Indian population is concerned. So we should follow, or we should stick to ICMR guideline. But these ICMR guidelines are based on so many things in the world. One is WHO, and another is NIH, National Institute of Health, which belongs to US. Okay, so ICMR guidelines are somewhat connected to these two things also. Okay, WHO as well as NIH, US FDA. Rather, correct word, US FDA, Food and Drug Administration of United States. Okay, so standard values are prescribed. Time to time, there is amendment in these standard values that has to be actually remembered by everyone. And we should know the inferences of these values. If the value of your test goes below this value or above this value, what happens? I'm going to talk about few things like blood pressure. So everyone knows the standard blood pressure is 80-120, systolic and diastolic. Systolic is 120, diastolic is 80. 80-120 is the classical range, basically not range, basically values of your systolic and diastolic. There is some deviation, like if you talk about systolic blood pressure, the range should be 100 to 120. For diastolic, 80 to 100. That means if your BP is not 80-120, but it is 85-125, don't worry. Don't worry. It is within range. If it is 90-130, again you have to take care of, but don't worry, because it is touching to that values. Now the question is, if it is moving from one level to another level, what are the factors? Age is one of the factor, and second is your lifestyle that you follow. Nowadays, we are finding younger people who are suffering from this blood pressure. Those who are having the blood pressure more than this range, 80 to 120, not basically 80 and 120. Okay, so 90-140 is little bit common blood pressure. Those who are at the age of bracket of 45 to 50. Okay, but if it crosses that, then you have to take care of. You have to go for medication. So for everybody, these values means a lot only when you have in correct age bracket. Okay, simply you have to correlate these values with your age also. I want to say this. Okay, now for hemoglobin, in male it is 14 to 18 gram. Okay, and for females 13 to 16 gram%. In children it is 10 to 13 gram. So lower levels of this, even in males it is less than 14, it is anemic. In females, definitely most of the females in Indian scenario are anemic in nature because they don't take care of themselves. They are busy into taking care of their male candidates in the family, and they don't really bother about their own health. Yes, most of the females have these issues, anemia. Hemoglobin count is less. So what to do? You have to improvise the hemoglobin count. How? You have to take more iron and vitamins. So that is the corrective measure that has to be taken care of. Okay, even RBC count, WBC count. So it has been written over there, neutrophils, eosinophils, basophils. One of the prominent things which people used to ask me about platelet count. Sir, platelet count is getting low. Infection is there. In dengue, the classical representation of dengue infection is very low platelet count. So what to do? You have to increase the platelet count. So we do have a mechanism wherein we can supply the platelet. We can add the platelet from outside the body. Okay. But if you naturally trigger, like papaya, you eat the papaya, it's a booster for the platelet enhancement. So that thing you must understand. Now, blood sugar. I would like to talk about blood sugar also. So in healthy people, the fasting blood sugar range is from 70 to 100. It's a range, basically. If you take meal, postprandial level will be up. Definitely. It is deciliter. Okay. So in this blood sugar, you have to monitor your age, weight, and then blood sugar. Simply for cholesterol also, 150 to 240 is range. So if it is less than that, okay. So 80 to 100, hemolytic jaundice is there. If the values are more, kidney diseases are there, heart diseases are there, liver diseases are there, obesity, hyperthyroidism may be the cause where you can find out the high cholesterol. So cholesterol, BP, sugar, these are the very keen indicators, health indicators of our population. So you can see kidney function test, KFT. See the creatinine, uric acid levels, sodium, potassium, calcium levels. So this is for your understanding. Okay, I'm quoting the examples and I'm trying to find out, trying to explain only those which are very important. Now, liver function tests are there, heart function tests are there. For the LFT, liver function test, ALT, AST, and ALP, the first three tests are very important. That signifies your liver damage or vitamin deficiency or malnutrition. Okay, so those who are suffering from liver disorders or diseases, first of all, you have to track your ALT, AST, and ALP levels. Then beyond that, bilirubin and GGT levels, gamma glutamyl transferase levels are more important because GGT levels basically directly signifies the liver damage. Nowadays, because of the lifestyle, we all are suffering a lot for this as far as liver is concerned. Okay, for even heart function test, total cholesterol, LDL, HDL, so levels are there, triglyceride levels are there, lipoproteins, apolipoproteins, fibrinogens. So anything, say for example, lipoproteins less than 30 mg per deciliter. If this value is going up, then heart and blood level diseases are there. So just by observing the deviation from the standard values, you can find out exactly the root cause. Similarly, HB1AC, 3-month cumulative 3-month sugar can be seen by using HbA1c. So it is 5.6 is the value. So you should try to keep your HbA1c below 5.6. Up to 5.8 also people used to go. Beyond that, it is pre-diabetic, and beyond that, it is diabetic. It shows the glycosylated sugar, which is linked with your hemoglobin. Okay, insulin levels are there. So pancreatic function test, gastrointestinal function test. So calcium, blood urea, white blood cell count, hemoglobin, potassium, sodium, all these parameters belongs to or indicates some of the ill healths if the values are getting deviated from normal ranges. So if you want to find out whether my pancreas is performing well or not, sorry, just go through amylase, sodium, potassium, calcium. So you will find the ability of your pancreas to function. Then next is your pulmonary function test. So spirometry is classical way, ability to inhale and exhale. Forced vital capacity is also there. I talked about this also previously. So it should have greater than 0.7. If the value is less than that, then breathing is restricted. Something is there, obstacle is there. So you have to find it out. Lung volume, respiratory muscle pressure, maximal inspiratory pressure, maximal expiratory pressure, that has to be calculated, MIP, MEP, that values. Now, these values depends upon male, female, that is one, and those who are athletes, those who are good runners. So in that respiratory muscle pressure and this pulmonary function test will be slightly different because they are practicing more. So lung capacity is always at the upper side. Those who are just having a normal healthy lifestyle wherein there is lack of exertion or exercise, rather correct word, exercise, those will have the deviated pulmonary function test values. Okay, so now these are another common test where you can have ammonia, cholinesterase, iron, microalbumin pyruvate. So you can go through it afterwards and you can study the chart. So now beyond that, we are using some equipments at our home level to actually diagnose. See, right hand side lowermost, pulse oximeter. Everyone knows this pulse oximeter. In corona, we use this pulse oximeter to find out the dissolved oxygen in our blood, and it should have values more than 96 in healthy, in normal respiration. Okay, so pulse oximeter. Digital thermometer. Now we do have thermometer which directly gives you the Fahrenheit temperature. Kelvin, most of the time it is Fahrenheit only. So there are three different you can say the values or the designations, but generally we calculate that fever in degree Fahrenheit only. Okay, so blood glucometer is there, then blood pressure monitor is there. So blood pressure monitor, I told you no. So you have to wrap that on your left or right hand, especially left, not right. Why? Why? What is the logical reason? Anybody? It's because your heart is at the left, no? Simple. So you should prefer the left arm. Somebody, if someone is preferring right arm, not that proper. Although it is going to show you the blood pressure will be same on the artery level. But if you prefer left, then it will be more accurate. Okay. So these are some small points you should take care of. Now uric acid test machine is there, cholesterol check meter is there, ECG, electrocardiogram machine is there, which gives you about the heart functioning. Huh? Okay. If you are suffering from some chest pain, so doctor will definitely first of all try to find out or try to get the information of ECG, electrocardiogram, and it will have a PQRS, what you can say wave, and just by observing PQRS, doctor will diagnose whether your heart is functioning properly or not, if something is wrong with your heart or not. Even blood analyzer. Nowadays, we do have blood analyzers which calculates n number of parameters in a single sample. Okay, those I discussed in this diagnostic test. So in point of care devices, we do have COVID-19 rapid antigen test, pregnancy test, kits, malaria detection kits. So these are the self-test kits which are available in the market. So these are the leading companies. I'm not going to read, but this is for your information. So if you want to know what are the leaders in this manufacturing, so you can refer this list. Now, up till this point, now we know what is happened in with me, diagnosis. But what is the next part of diagnosis? After diagnosis, you have to take a treatment, correct? And in treatment, the important role of the medicine comes in the picture. First of all, we try to treat this disease, disorder, or syndrome, whatever you call it, with medicines. If not, with injectables, it comes under medicine also, but only route of administration is different. And if it is beyond the scope of that, we go for surgery. Okay. So first and the foremost role after diagnosis in our health management is of medicine. Okay. So for medicines, first of all, you should know what is the meaning of drugs. Drugs. So who will define that? So US FDA has a classical definition of drugs. A substance recognized by an official pharmacopoeia or formulary. That is one way. The substance intended for use in diagnosis, cure, mitigation, treatment, or prevention of the disease. That is the another definition. Third definition is a substance intended to affect the structure and or function of the body. It is not a food, other than food. And fourth definition is a substance intended for use as a component of a medicine, but not a device or a component, part of accessory of a device. It is not a device, basically. So the best way is second definition, substance intended for use in diagnosis, cure, mitigation, treatment, or prevention of diseases. API, active pharmaceutical ingredient. So now, what are the sources of the drugs? So drugs can be synthetic, semi-synthetic, and natural. Synthetic, those drugs which are prepared, synthesized in the laboratory. Classical example is paracetamol. Everyone knows paracetamol, antipyretic, analgesic molecule is a very old molecule, very famous molecule. But while using paracetamol, try to be very cautious because paracetamol, basically metabolites are liver toxic. Basically, they damages these metabolites damages the liver. So try to be very specific while using paracetamol. Semi-synthetic, that means naturally isolated and modified in the laboratory. Classical example is paclitaxel, anti-cancer drug, even etoposide, podophylotoxin, etoposide. And another source is natural, same components from the nature itself we are using as a molecule, as a drug. Classical examples are there. Morphine, it's a analgesic, but this is narcotic analgesic. It is controlled substance. You cannot directly use it, but this kind of molecules are prescribed in terminally ill patients like cancer. Okay. So now the question comes in mind, sir, we know drugs, how to define drugs. What are the sources of the drugs? How do we invent the drugs? Invention. Okay. So drug development and drug discovery. So first step is drug discovery followed by development. So drug discovery to drug development. So this slide, I purposely kept this picture. This is available in the on the net. You can search it. That reference is there. But this is one of the classical way of explaining whole process. It contains almost all the information. So now one by one we'll discuss. Any drug which comes in the market, it takes around 15 to 17 years. You can see the early discovery from year to early discovery 2 to 5 years, and the development phase 5 to 15 years. So this discovery process, if you make a total, it comes around 15 to 17 years. So a drug, when it comes in the market, it has already covered 15 years of its journey at least. And for this 15 years, the average cost is $40 million. This is very old price. I tell you, now expenditure is quite more. Okay, but it is in millions. So now you can guess how much amount is needed to develop one single molecule as a drug, one single molecule. Now, the first portion I would like to talk about early discovery. Early discovery is first phase where we identify the target validation. Now, there are two approaches. Previously, how people were trying to develop the drugs, do you know? Synthesize n number of molecules, go for all the activities, and the molecule which is showing the activity, collect that molecule and develop it. That was an old story. Now it is not like that. Now, do you know how we do? Basically, we try to find out the target. Target means it's a lock and key model, receptor. We try to find out the receptor in the body. Say suppose, I'm going to explain one example. I want to develop a medicine for the BP, blood pressure. So technically, the blood pressure, if you want to maintain the blood pressure, you have to make the blood vessels flexible, correct? So in blood vessels, there are beta receptors. So nowadays, the technology is we isolate that beta receptor, try to build its structure computationally, and try to find out some molecules, chemical structures, which are going to fit into that beta receptors. Okay. And that series of compounds we try to synthesize. And after synthesis, again, we go for activity. And this portion up to activity, in vitro and in vivo, this comes under early discovery phase of the drug. Now we are trying to discover any molecule as a drug, correct? After that, if it clicks, then we try to develop that molecule further. Then it comes under drug development process. So first of all, we try to use that molecule in the animals. That is called preclinical development. Preclinical in animals. We try to develop the efficacy of that molecule in animals first. And if we find that molecule safe in animals, then we launch that molecule into clinical phase. In clinical phase, there are phase 1, 2, 3, 4. One phase is missing here, phase 0. That has been launched in 2005, 4 or 5. So phase 0 is also there, where we try to find out only the restricted pharmacokinetic parameters of the molecule, which is not covered here, but that is there in the literature. Phase 0, 1, 2, 3, and 4. So phase 1, 2, 3, if molecule crosses all these phase 3, it goes into phase 4, where that molecule is already in the use, but now people are trying to monitor that molecule. Example, classical example of that post-marketing surveillance, and the benefit is your nimesulide. Nimesulide is one molecule which is analgesic in nature. That molecule has been invented by US government, US company. That molecule was launched globally, nimesulide. Again, after during post-marketing surveillance, the US people found that this molecule is causing the liver damage. So US government banned that molecule. Unfortunately, we are using that molecule in India. So how come we came to know that molecule is toxic in nature? In phase 4, post-marketing surveillance, it was identified that this molecule, although it acts as a drug, it is damaging the liver. Stop the use of that drug. So phase 4. Okay. So now, got the point how it is developed a molecule from early discovery to development phase. Now, the next part of this is attrition rate. So if you start with 10,000 molecules at the early discovery phase, do you know the drug molecule which is coming out of that 10,000 molecule will be only one single molecule. Can you imagine? This is the attrition rate. You can see the percentage 60, 50, 40, 40, 30, 60, 70, 10. So after this kind of attrition, the last molecule remains at the phase 4, phase 3 is only single molecule out of 10,000 molecule. If you start with 10,000 molecule, see the rigorous, tedious, time consuming and very stringent process. You cannot use any chemical as a drug. You are not supposed to. Every chemical, if it has to be developed as a drug, it has to cross all these processes. You can see the description. Each stage output is input for the next one. This explanation, pipeline and all those stuff. But am I clear? Any molecule, if you want to develop as a drug, it takes 15 to 17 years. It is in millions. Cost goes in millions. It has to be developed in first preclinical level. That is called animal studies. Then you can go for clinical after permission. Only you cannot shift from preclinical to clinical. Mind it, huh? It is ICMR which governs the clinical trials. Okay, you have to seek the permission. You cannot conduct any clinical trial without the permission of ICMR in India. ICMR is playing a very important and vital role. Nowadays, our health ministry department is very keen and very observant whenever these clinical trials are conducted in our country. Okay, so got the point. So this is about drug discovery and development. So now what are the advances in the drug discovery and development? So in drug discovery and development, now there are integrations of 3 approaches. First approach is now we are coupling mind and machines together. So we are using our brain as well as machine approach. Okay, so that is the best advancement in the drug discovery and development. Mind plus machine is cocktail approach. We are following that. Now we do have computers. So you have a huge data to handle. So manually, if you try to handle the data, it becomes very difficult, very difficult. So what to do? Use the computational methods, computer based. Okay. So second advancement, roll number 5, mute your mic. Roll number 5. So second advancement is computers. And the third advancement is extensive use of artificial intelligence, AI. So extensive use of AI in drug discovery and development. So is the latest advancement. So how I will explain that AI in the drug discovery. See, so this is the classical diagram which is available. You can drag it out, you can dig it out from the net itself. Okay. So in drug discovery, so if you have say left side, upper left side, molecular structure is there, you can take the help of AI, artificial intelligence, and you can find out the drugs where it is clicked. Okay, left and bottom side. If you have target, if you have drug, combine this information, use the AI technique, you can find my drug is going to interact with the target or not. So artificial intelligence will help you out before actually studying see, there are 2 ways. One way is to do it by using your computational techniques, by using artificial intelligence. And another way is to do it in the laboratory. But while doing it, these experiments in the laboratory is quite costly and it causes the loss of lives. Okay, that means you are using animals. So you are using actually animals. So in that case, if you want to save that animal life, so use these AI techniques and computational methods. Okay, now right side. If you have sequence, so AI technique will give you the structures out of that. If you have targets and drugs, encode that. So it may give you the idea whether your drug is going to bind with your target or not. If it is proven by using computational technique, then only you have to go for the laboratory. So this is the classical role of AI in the drug discovery. Got the point? Yes. Another part in AI as in the drug discovery. So AI plays a very important role as far as drug discovery and development is concerned. So AI has a huge role in the starting identification and validation of the targets. You can get the data set into computer, identify the targets. You can predict the target role and you can predict the even signaling. Okay. Now, lot many times, do you know what happens? In vitro, outside the body, if you are testing the molecule, it shows good results. But when it goes to actual situation in the body, let it be animal body first. Okay, I'm trying to explain that by using the preclinical example. So if you use the molecule in the animal, you find that there is a loss of activity. You are not getting the expected activity. Why? Because now that is the real situation wherein your molecule will travel inside the body. It will meet out the challenges inside the body. Okay, and there will be a typical real picture of your molecule, whether it is going to show you the correct results or not. Okay, so ADMET prediction by using AI technique, if you do it, so then you can save the life of animal, no? Okay, unnecessary exposure of the chemicals to the animals is also not advisable, is also not permitted. My dear participants, for any animal studies, you have to seek the permission from the Animal Ethics Committee of your institution. For the human trials, you have to seek the Human Ethics Committee permission from the medical college, or you can say your governing body. So it is very difficult to use anything without permission. Even prediction of the toxicity, drug repurposing, even pharmacovigilance, you can have the AI in your drug discovery. Okay. So now what is the future of drug discovery? Okay. So now we know AI is there, artificial intelligence. Now onwards, in drug discovery, it will be something like the cloud data. Database is there. It's a virtual space which is available to store the data. The medical records will be there in cloud. Okay, cloud format data will be there. We'll pour the information in that cloud. We'll try to process the information. Even clinical trial data will be there in that. All human knowledge, historical patient data, then technological advancements, biomarker explosions. All this data will be actually pumped into population pharmacokinetics. While this population pharmacokinetics data, there will be deep learning, predictive analytical techniques will be used, translational techniques will be used. So we'll use machine learning, natural compounds or libraries. You will use speeches, visions, text. Every data will be coupled through AI. That data will be pulled. That will be supported to given to medical doctors, labs, response services, and that all this integration will be done at the cloud level. So in future, if you want to develop anything as a drug, you will have ready reckoner data from AI as well as the laboratory. So wet laboratory data will be there, in vitro, in vivo data will be definitely there, but the AI data will be also there, and your knowledge system data will be also there. So before going for any experimentation, any experimentation, you can visualize what will be the fate of your molecule. Just like previous slide, nowadays in drug discovery, we do have fast track designation, accelerated approvals, breakthrough, and priority review. I will explain this in somewhat lucid manner. Any molecule, when it enters in the development stage, it has to cross this approval processes. IND approval, investigational new drug approval. Then it has to cross AND, application, new drug application, and then it goes to market. So priority. So for every stages, the agencies, government agencies, if you want to develop, if you want to designate a molecule as a drug in India, you have to submit the data to DCGI, Drug Controller General of India, DCGI. If you want to do it in US, then the authority, US FDA, you have to submit the data. They will go through data. They will find out the reality checks. Okay, they will validate the data and then they will approve the data. But now you let me know 15 years data or 7 years data, so huge data. If you want to even read the data, it takes time. Am I right? So approval process are now accelerated. That's why in Corona, we got the vaccine at the early stage. The classical way of accelerated approvals is Corona vaccine in the India. And that's why it was possible to save the lives of our own population as well as world population. We were able to export that vaccines throughout the world. Why? It was possible only because the approval process was fast. Priority reviews were done and Indian government supported like anything because it was a epidemic. And mind it, I'm very proud of, I belong to community, basically the medical community where India is leading the world. And in real sense, it was quite possible because of the researchers in the India. what they extraordinarily done while developing the vaccines. Serum Institution, Hindustan Antibodies, everybody tried, even companies, our private companies in the India, they tried their best and we came up with some vaccines which saved our life. So this is the future of drug discovery. Again, this example is there. In 1950, we were based on herbal medicines and some of the lower molecules. In 2010, now we have shifted our approach. Although we are using herbal medicines right now also, but now we shifted our approach. Now we are more focused towards chemistry and biology, and we shifted from that to genomics. Now molecular biology, system biology is there, human genetics is there. So now in 2010, we have antibodies, immunotherapies, gene therapies, cell therapies. So this is a paradigm shift from traditional medicines to from conventional medicines to unconventional realistic biosimilars, which are more safe and more efficacious. So in summary, I would like to say from my side, health is one of the important aspects of the human life, that is rock bottom line. Second is health can be understood by various integrative approaches like Ayurveda, homeopathy, naturopathy. By any means, you cocktail the approach, you can understand the health very well. Ill health can be characterized by various diagnostic methods. You follow Ayurveda, allopathy, doesn't matter. What matters is your diagnosis. Point of care testing devices are now integral part of human health management. Everybody is having that BP machine at our home, and kids are at our home. Why? Because our population is under threat. No, so point of care testing devices are our daily part, life's daily part. So API are the support pillars of the human health management. We cannot avoid the medicines right now also. Although yoga, meditation, it is helping us like anything. Last 10 years, we did wonders in our population, and we are getting the good effects of yoga, meditation, and everything. But still, we need some support from the APIs. Now, API discovery and development process is a systematic and planned activity that you know. Advances in API drug discovery and development process are now expediting its approval process. Definitely. And the biologically similar components, biosimilars, is the future era of this drug discovery and development. Like insulin. Now we are using insulin, biomimic insulin, because if your insulin molecule is similar to your original insulin, just which is produced in the body, then it will not have any side effects. No. So now we are more towards biosimilars. So biosimilars is the future and new era of the drug discovery and the future. So this is from my side. Okay. So right now, if anybody is having doubts, any questions, you can ask me the questions. I will try my best to answer your questions. So this presentation is a typical presentation which I tried to give you the cocktail integrated approach about the health and health management, some aspects of new drug discovery, development, and the future of drug discovery. So overall, if you go through this presentation, you will come to know what was the starting point of the in past and what is the future of drug discovery and development with respect to human health management. Thank you. Any participants, anybody would like to ask the questions?
Hello, sir.
Yes.
So I have a question.
बोला.
Is the generic drugs are as good as the general drugs?
क्या बात है, very good. What is your name, sir? Roll number 21.
Dr. Jaykumar Shamraj.
Dr. Jaykumar, sir. That's a good question. Basically, first of all, I would like to tell about generic and branded drugs. So generic drugs are the drugs which are come in the market with the name itself, paracetamol IP 500 mg, and the branded is Crocin. You know that. Now it has been basically imbibed in our mind that generic drugs will not have that kind of quality. But it is not the case. It is not at all the case, because the manufacturers will take care of the manufacturing of that particular drugs in a similar manner. Without that, he or she won't get approval. So don't basically think that branded drugs are good quality drugs and generic drugs are cheaper, or because of their values, they are substandard or less standard. It is not like that. As far as my opinion is concerned, generic drugs and branded drugs, at the quality parameters, both must be same.
पण ती काय होतं सर, जे स्वस्तात
हा.
मिळतं त्यामुळं त्याच्यावर संशय येतो.
करेक्ट 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 सर. कसं आहे माहितीये का, तुम्हाला खरं सांगू का,
हा.
व्हेरी ऑनेस्ट, सॉरी फॉर द रिजनल लँग्वेज, एनीबडी फ्रॉम आउटसाइड द महाराष्ट्र प्लीज बेअर विथ मी. त्यांना आय एम गोइंग टू
नाही,
और हिंदी में
इंग्लिश
बोलता
मध्ये
हूँ मैं.
सांगा. पण ते काय असतं, 35% 40% सूट म्हणले की आपल्याला वाटतं त्याच्यात काहीतरी खोटाच आहे.
हा, तेच तेच मला काढायचंय. असं नाहीये
हं,
सर, खरं सांगू का सर,
हं.
जनरिक ड्रगचा कन्सेप्ट आणलाच यासाठी. अहो सर, मला सांगा, जी गोळी 20 आणि 25 पैशात मिळते, ती जर
हो
3-3.5 रुपयाला विकत असतील, फार्मास्युटिकल कंपन्या अब्जावधी रुपये कमवतात.
हो, त्याच्या
आता
मागे
मला
एक
सांगा,
रॅकेटच आहे ते.
पैसे कमवायला ना नाही, अरे तुम्ही कमवा ना, तो काही मुद्दा नाही. पण काय सर, त्याचं
हं.
एक विशिष्ट कॉस्टिंग आहे आणि सगळ्यांना नाही हो परवडत. आपले
नाही,
कंडिशन,
नाही. आणि
इंडियन
तर
पॉप्युलेशन.
एवढं बेकार आहे ना, म्हणजे मला तर वाटतं सगळ्यात मोठा 2 नंबरचा धंदा हाच असणार आहे, मेडिकलचा.
आता ऑनलाईन प्लॅटफॉर्म मधनं ह्याच्यावर
तरी पण ते
विश्वास
आता
करणं योग्य नाही.
ते मी बघितलंय कोरोनाच्या काळामध्ये मी
हा,
काम
येस
केलेलं आहे.
येस सर.
त्यामुळे मला अनुभव आहे.
हा, नाही बरोबर आहे. यू आर राईट सर, यू आर राईट.
हं,
तुमच्या स्टेटमेंट मध्ये कॉन्ट्राडिक्शन काही नाही.
हं.
पण हा, जस्ट ट्रस्ट ऑन जनरिक ड्रग्स, डोंट वरी अट ऑल सर. कारण
ओके, ओके.
जनरिक ड्रग्स मध्ये मॅन्युफॅक्चरर कोण आहे एवढं फक्त बघा. जनरिक
हो.
ड्रग्स मध्ये जसं आपण ब्रँडेड मध्ये आपल्याला क्रोसिन म्हणलं की माहिती आहे ना, ग्लॅक्सोनी बनवलेलं आहे किंवा कॅल्पॉल ब्रँड आहे तर ग्लॅक्सोच आहे.
हं.
जनरिक ड्रग्स मध्ये मॅन्युफॅक्चरर थोडंसं बघा. बाकी ऍज फार एज क्वालिटी इज कन्सर्न, आय एम डॅम शुअर बोथ आर सेम, आर रादर बोथ मस्ट बी सेम.
ओके,
Okay,
ओके.
thank you, sir. Anybody else? Anybody else?
Sir, actually, my roll number is 11. I want to ask one question.
Okay.
Sir, what is the feature of diagnosis by the doctor? Is this the AI will help certainly for that to quickly diagnose? Actually, sometimes it might be possible based on the symptoms. Some doctors are not able to find out the actual disease. So it's a longer time to solve the particular kind of disease. Does the
Ah.
AI help in that
Yeah,
regard?
yeah, yes. Sir, nowadays there are concepts like lab on chips, lab on chip. So if you take a blood sample, small blood sample, you can analyze. I told you, blood analyzer is there. So if you aspirate 50 microliter, can you imagine 50 microliter is only one drop? So it can give you about 70 tests at a time. 70 tests. Now, issue is, sir, it is first of all, it is not the issue of technology. It is about the integration of the symptoms and the clinical results. What happens, do you know? Why there are some doctors which are having good practices and some doctors, they, although they have same degree MBBS, they don't have that kind of patient pool. Reason being, you should be able to correlate the symptoms and your clinical investigation. That is one problem. And second, in AI we have database. I showed you the second last slide, no, future of the drug discovery, wherein in cloud system now we do have all data pooling at one place. So it will be easy for any doctor, if he or she access that data pool. So if he actually correlate his clinical finding with the database, no, so it will be easy to diagnose properly. So the one way is, if someone is suffering from fever, so fever can be because of anything, even simple sneezing, and your cold weather may give you the feverish. You may feel feverish, but to find out the exact reason of the fever, what you have to do is blood test. Correct. In malaria also, in first 6 hours or 8 hours, you won't get the symptoms. After that, you get that chilling. So chilling is the classical symptom of malaria. Any doctor who is very good enough in this clinical symptoms, he should pick that symptoms quickly. But generally, by chance, if you miss that, then it takes time. So AI can help you there. In AI, in cloud database, you have to just fill the information. Now, you may ask the question, sir, it may be false positive or false negative. Yes, there are chances of false positive and false negative. So you have to correlate the clinical symptoms with the database. Yes, AI is going to help you.
Thank you, sir.
Anybody?
Excuse me, sir.
Yes.
Yeah, while we were diagnosing, Ayurveda has used several types, but whether we can get a clear picture from this Ayurveda diagnostic system or not.
Sir, problem is, uh, it is just like doctors. If you practice pure Ayurveda, if you have in-depth knowledge, then you can diagnose properly. But the issue is nowadays there is change in the format of the disease also. Correct. Say suppose,
Yes.
say suppose corona is the classical example. Now it is upper respiratory tract infection. Correct. In simple manner, it is upper respiratory tract infection. But that infection is crossing that not only upper respiratory tract, it is going up to alveoli level, and it is modifying that alveoli secretions. Correct. So in Ayurveda, although it is a non-invasive technique, you can directly find out whether something is going with upper respiratory tract infection only. In allopathy, we do have provision of checking that at the chemical level. Okay. So now your question is whether my Ayurveda is going to give me the correct diagnosis or not. Sir,
Yes, sir. Yes.
Ayurveda can give you the correct diagnosis. Only thing is you should be able to correlate. Because see, in previous era also there were human beings, there were health issues, but they were able to sustain. Now we have something like BP and diabetes. This is a lifestyle diseases. These are the lifestyle diseases, and just by correcting your body and mind, you can prevent that. And with the help of Ayurveda, you can get the idea also. Yes, my logic says that if you have good Ayurveda charya, sir, nowadays also we do have good Nadi Pariksha Tadnya also. So they can give you that you are suffering from this. I heard something somewhere that Nadi Pariksha Ayurveda Charyas can actually locate where the problem is. Only thing is we are unable to transfer this knowledge to a modern system of medicine. In Pune, I would like to share some information. In Pune, somebody has developed a device which can be placed on your arteries, and you can convert that nadi vibrations into diagnostics. So that kind of integration should be there. Only thing is you must have a good Ayurveda Charya who is having a sound knowledge. Unfortunately, we lost that ancient knowledge. That's the problem.
Okay, sir. Myself from Kerala, Kottakkal Ayurveda Shala.
Oh,
Have you been here?
Sachin,
Yes,
nice to meet you. Nice to hear you.
Okay, thank you. Okay, thank
So you have a good background, no?
Yes. That's why.
You know the facts. Good.
Yeah. Okay,
Nice
thank you.
to talk
Thank
to
you, sir.
Okay. So now we'll have a 15 minutes break. If somebody is having questions, please ask. Otherwise, we'll take a break. 15 minutes break.
Sir, I am having one question. Roll number 5, Dr.
Roll
Patil.
number 5, yes.
Sir, I have taken one BP monitor to measure the BP for my mother, but every time it shows a different readings.
Okay.
So,
what to do?
How we trust it?
How we trust
it? Better brand for it.
Correct.
Yeah.
So that's why I purposely gave a list.
Because every time it shows the different readings.
Yeah.
Yes, sir.
I'm telling you why it happens. See, it is just like manufacturing, where you got it. So that's why I purposely kept one list in my presentation. Who are the leading manufacturers of these devices? That is one part. Second part is.
Sir, can we trust on it, sir?
Yes,
म्हणजे
sir.
आपण त्याच्यावर भरोसा ठेवू शकतो का?
नाही सांगतो ना ते
म्हणजे आपण त्याच्यावर भरोसा ठेवू शकतो का? आता लीडिंग ब्रँड आहे.
करता येतं सांगतो ना. But there is one way to deal it. Whenever you are measuring the BP, no, first of all, keep this thing in mind that at least 3 times you should measure it. 3 readings should be there. एकामागे एका मिनिटाच्या गॅपनी किंवा 2 मिनिटाच्या गॅपनी 3 reading घ्या. You just observe for 3 times and take a mean value of that. Reason being, it is electronic machine. It has some circuit. It has some electric supply. So electromagnetic radiation of itself machine may have some noise in the observation, and that happens really. That is one part. So you have to go for at least 3 readings. Second is, whenever you are measuring the BP, just try to observe that your patient is actually sitting nicely. There is 90-degree angle at your left hand. I told you, no, left hand you have to use. So yes, 90 degree should be there. And if you are trying to measure the blood pressure at the early morning, 7 or 6:30 वगैरह, so at that time you will find that the BP is slightly low. If you try to measure that BP at 11:30 or 12:30, it will be slightly up. It is a natural rhythm of the body, biological system. So what to do? What to do? Whenever you are relaxed, 15 minutes rest, then you measure the BP. So these are the factors. Sir, तुम्हाला काय
Yes, sir.
करायचंय? बीपी मोजत असताना, सॉरी फॉर द रिजनल लँग्वेज, प्लीज फॉरगिव्ह मी. तुम्हाला बीपी मोजत असताना 15 मिनिटं रिलॅक्सेशन पाहिजे. त्याच्यानंतर बसून मोजायचंय. लेफ्ट हँडला 90 डिग्रीचा अँगल पाहिजे आणि 3 रिडिंग ऍटलिस्ट घ्यायच्या. गॉट द पॉइंट?
Yes, sir. Yes.
You can rely upon that. Take an average value, definitely. कारण ते machines calibrated असतात. I'm telling you that machines are calibrated one. Calibrated one. Don't worry. There will be slight difference, plus minus, but not a major. असं होणार नाही की नॉर्मल पेशंटला हायपरटेन्सिव्ह दाखवलंय, असं नाही होणार. You can rely upon that. Anybody else? और किसी को क्वेश्चन पूछने हैं? Okay. So we'll have a break. Okay. 15 minutes break. Thank you.
Yes, sir. Thank you, sir.
Thank you, sir.
1 वाजता प्रेझेंटेशन ठेवलंय सरांनी, 12चं होतं. इतकं पळवतात ना हरके सर, विचारायलाच नको. गेलेत आता आता 1ला बोलून बसले मी एक्सपर्टला, 12ला नाहीये सर, 1ला करा. आता 1ला पण सर नाहीये, आता परत बोलायला आले. मूर्ख आहेत हे लोकं.
Okay, participants, we'll start with next session. चालू करायचं?
Yes, sir. Yes, sir.
Yes, chalo. So once again, good afternoon. So for last lecture, we were more into human health, and in human health also, we were trying to identify what are the pillars of the human health, what is the role of drug, then what are the advances in the drug development discovery. So if you have some chemicals or something with you as a drug, so now it's a business affair wherein you want to explore that molecule as a drug and you want to earn something. Okay. Say suppose if you have a research and development team with you, R&D. Okay. And in R&D, if you want to explore that molecule commercially, so you must have something with you that is called intellectual property right. And this is the starting point of our next session. Okay, so title of today's second lecture is Patents Theory to Practice Pathway. So before starting this session, I would like to tell you that after completing this presentation, at least you will get the idea that what are patents, how to file the patent, and it will be more towards practical approach. Last session, where you find that half of the part was theoretical and half was little bit practical. For this session, most of the part will be practical because there are several actually issues while practicing the patent. Whenever you say practicing the patent, it starts with filing the patent, getting approved the patent, issue, and then use the patent for your commercial benefits. So for that, you must have a clear understanding about the patents, what is patenting, and that too in context of Indian scenario. That too in context of Indian scenario. Correct. So in this case, it starts with your baseline. Whenever you have, it is just like your property. So if you have house, car, okay, furniture, okay. So we do have bills of that. In that bills, we do have our name, phone number, and details of that. So we do have evidences, documentary proofs that these assets belongs to you. Correct. So in similar way, you must have these kind of rights for your brainchild. That is called your invention. Invention. Okay. So this lecture will give you the idea about this intellectual property rights and securing that intellectual property rights for your benefit. Okay. So this patents theory to practice pathway. So for today's session, the scope of the presentation will be, first of all, we'll try to understand what is IPR, intellectual property right. What is that? So introduction will be there, types of IPR will be there, and after that we'll focus towards patent only. Patent is one of the aspects of the IPR. Okay, but as we all belongs to domain, most of us basically, it's orientation program, faculty development program. So I think science and technology both will be there, and plus some others may be there. So while practicing inventions or while practicing our knowledge set, the right should be reserved. So patent is one of the classical way of securing the rights. So we'll be more towards patents. And while studying the patents, we'll see criteria of the patentability, basically whether my invention is patentable or not. Then types of the patents, then patent application types, then what are the core requirements for filing the patents, and what is the patent filing procedure. Because last 10-15 years I am in this area. Wherever I go and I talk to people regarding this IPR, the most of the questions comes from this segment. Sir, how do I know that my invention is patentable or not? That is, then if so, what are the procedures? How do I proceed? What should be the requirement? How to fill the form and everything. So that's why for this session, it will be more practical way of explaining the IPR. Correct? So this will be the scope of the presentation. So let us start with the intellectual property rights, IPR, intellectual property rights, Bauddhik Sampada, and intellectual property of rights. So it's a creation of mind. Whenever you say invention, literary, artistic work, design, symbols, names, images. So basically all this strata, it's a creation of mind. Mind creates it. See, logos, vehicle logos. Just by looking towards the vehicle, you can identify it belongs to Tata, it belongs to Hyundai. How come? Uniqueness in the logo. Okay. Even bottles, cold drink bottles. Just by observing the bottle, you can say Coca-Cola, thumbs up. Why? Shape. Okay. Images, designs, Apple symbol. You can easily identify this product belongs to Apple because symbol is very classical symbol. And this is all creation of your mind. Okay. So IP, intellectual property, is the property created by application of human mind. Creation of your mind. Okay. Application of your own mind. So now intellectual property. So what are the classical characteristics of the intellectual property? That one has to understand. What is intellectual property and what are the typical characteristics of the intellectual properties? So first property of the intellectual characteristic of intellectual property is roll number 24. माइक बंद करा.
सर ते शाळा कोणा ठिकाणी होती नेमकी?
रोल नंबर 24 माइक बंद करा.
सरकडे सरकून नंबर घेतला होता मी. ढवळे सर म्हणजे भोकरदन नाका.
इंदुरकर सर माइक बंद करा.
आत्महत्या केली.
Okay. So first characteristic of intellectual property is it is intangible in nature. So it's a non-physical. Bauddhik Sampada, you cannot have that physical form. It's non-physical basically. That is one characteristic. Second characteristic is by this intellectual property right or with the help of intellectual property rights, you can speed up or speed up your techno-economic growth. How? Yes, I am going to explain that also. And the third characteristic of this intellectual property is it is territorial in nature. Territorial, area specific. If you have intellectual property in India, so it belongs to India only. That means it is applicable in Indian region only. Okay. Classical way, if you have Indian patent, that is applicable for India only. Indian patent cannot be applicable in US. Technically, in a correct way. Okay. So these are the three characteristics of the intellectual property. Now, these property rights can be achieved, can be gained. How to reserve the rights? The next part comes in mind. So up till now, we know intellectual property, it's a creation of mind where we create symbols, designs and everything. So there are three typical characteristics of the intellectual property. That is another way. Now question is, sir, if it is a property, how do I own that property? How do I own that property? So you can secure patents, copyrights, trademarks, and you can own the property. Okay. And another broad spectrum part of this property is IPR is it is a monopoly for the specific time period. What is the meaning of monopoly? Monopoly means for a specific time period, you will be the only practitioner of that patent. No one else can practice that patent. Actually, in somewhere my presentation, you will find that dialogue also. It is a negative right. It is not a positive right. Basically, by securing the patent, you are stopping others to practice that invention. What is the reason? Because that idea, invention, creation is of your own mind, no? Your own mind. So that's why you do not allow others to practice. So it's a monopoly for a specific period. Say 20 years, patent life is 20 years. So for 20 years, you are the sole executioner or practitioner of that patent. No one else can. If somebody tries, no, he has to give you the money, royalty, everything. Even not royalty, basically, it is a fine. You cannot actually, what you can say is void the volumes in that. Okay, you cannot practice others' inventions unless and until it is lawfully opted. Okay, so monopoly. Now, again, question comes in mind: what is the need of the IPR? Why do we need IPR? So there are several reasons. Basically, mottos you can say, or what you can say is essence. If you have your own idea, so you are a creator, no? Creator. So your right must be reserved. That should be applicable, that should be owned by you only. So how to safeguard the right of the creator? This is the intellectual property, IPR. You are actually securing the rights of the creator. So creator is getting benefited out of that. So that's why if you want that benefit, you must have IPR with you. Intellectual property rights should be with you. Second requirement, why do we need IPR is IPR helps you to do the business. Now question comes in mind, sir, one side you are saying it's a creation of mind and another side you are saying it's a business. How come? It's very simple. Say suppose you have tomorrow come up with some idea of water purification by special technique. One special material is with you, which is generated out of waste, and you are able to purify the water. So that is your innovation, correct? If you secure the patent of that material, you can sell out your patent. You can sell out your idea. You can sell out your IPR. So it will help you to do the business. Got the point? Next, it is a key for economic growth. Although this property is non-physical, it is in your brain only or somewhere on the paper. Okay, non-physical, non-tangible asset. Just by selling out that, you can enhance your economic growth. Correct? Then, next is, say suppose, most of the time, even not say suppose, basically, inventors may not be good businessmen. It happens everywhere. I do have that part on my part also. I am little bit actively engaged in research, but I don't think that I am a good businessman. Okay. Reason being, for business, you need a different skill set. For research and invention, you need different skill set. Suppose I have some brain property with me, say like IPR with me. I can transfer that property or technology to someone who is good enough in the business. So while transferring this, it is quite possible to transfer this IPR when it is in secured form, patent and everything. Okay, so it facilitates the transfer of the technology. Now from my side, I can hand over the process to some company which or that company can practice it. That company can manufacture the chemical by using my technology. So transfer of technology is quite possible through IPR. And it is a cycle. It is going to give me the money. So if I am getting the money, definitely it is encouraging me to go for further inventions, because it is not only technology driven, but it is business driven also. Correct. So that's why it encourages the innovation. So these are the reasons why, because of which one should have IPR, secure IPR. Now, in types of IPR, next part comes, sir. Last three slides we are talking about the IPR. What is IPR? What are the characteristics? Why do we need IPR? So, question is, what is the form of the IPR? Format of the IPR. So, in layman language, you can say types of the IPR. So, these are the types of the IPR: patents, trademarks, copyrights, trade secrets, geographical indications, industrial
त्यांचं
designs.
म्हणणं आलं, अनुराग
These are
इथे
the
ऍज अ फॅकल्टी म्हणून
formats of
एन्व्हायरमेंटल
the
सायन्सला
types of the
दाखवला होता व्हिजिटिंग
or formats of
ते
the
सुद्धा
types of the
चालत नाही
IPR.
आरतीमध्ये.
Roll number
तेच
24.
प्रश्न घेऊन बसले.
Roll number 24.
नाही, तिला नाहीये ना सारखी अजून, ती आत्ताची आहे ना, ती करेल
Roll
एखाद्या
number
सारखीला केलं
24.
तर तिला सोडावं लागेल.
Roll number 24.
हो, पण सारखी नाहीये मॅडम तिला अजून, पण फुल टाइम आहे. हो,
Mic mute करा. Participants,
त्यांना
mute your
पेमेंट सुरू आहे
mic.
ना मॅडम, पण अजून पेमेंट सुरू आहे त्यांना. ते पण असेच आहे.
उन्होंने लेक्चर ज्वाइन करके छोड़ दिया, बाजूला चला गया.
और त्यामुळे काय व्हायला
बंद ही नहीं
डिस्टर्ब
करे
व्हायला लागलाय ना, अभी डिस्टर्ब हो रहा है ना यहाँ पे.
डिस्टर्ब होता है सर केवल सही से.
सर आप उनको म्यूट कर सकते हो सर.
अभी मैं दूसरी से वही कोशिश कर रहा हूँ, अच्छा नहीं लगता मैडम.
बरे हँडल केल्या हो.
अभी मैं यहीं से करता हूँ.
जबरदस्ती.
ऑप्शन नहीं दिख रहा ना. ओके, एक मिनट. Okay, so see, to mute from my side, I don't think it's a good practice. Everyone should have that understanding. We are in that lecture, so everyone should understand some decorum of the lecture. Okay, forget it. So these are the types of the IPR: patents, trademarks, copyrights, trade secrets, geographical indications, and industrial designs. These are the ways by which you can secure the IPR, intellectual property rights. Every part represents different things. So, what is patented? What can be patented? What cannot be patented? What are the characteristics for the trademark? What material can be copyright? So, these are the types only wherein different aspects can be covered in different domain, like patents, trademarks, copyright, trade secrets, geographical indications, and industrial designs. Little bit about this. Little bit about this industrial designs. I would like to have words with you regarding this industrial designs. You may have some contour plots, some specific designs of jobs which are commercially important, and now you want to do business with that, just like specific shape bottles which are for specific products, so that you can cover under industrial designs. So once you file a right for the industrial designs, so that shape of the bottle no one can actually mimic. Okay, so that comes under industrial designs. Like phones, if you have handsets, just by observing handsets you can identify it belongs to iPhone, it belongs to Apple, it belongs to Samsung. Reason being, outer contour shapes are registered somewhere. Okay, so just like these examples, you can cover different information under these different domains: patent, trademark, copyright, trade secret, geographical indications, and industrial designs. So now, what is protected under what? I was talking about this only. So product, process, even new applications, that all comes under patents. If you have some innovative products with you, so you have to go for patent filing. If you have process development, which is innovative, last last month, one of my student, BTech student, he worked on one of the industrial scale project. Basically, that process, we were trying to make it more safe. That was a closed vessel reaction, and we were able to achieve some of the safety norms in that process by modifications. So if you have this kind of modifications which are commercially applicable, so you can go for patenting. You can secure the rights through patents. Suppose you have repurposing, like classical way, remdesivir. Remdesivir is a old drug, antiviral drug, which we used in corona. Although no one claimed for the patent because situation was not that up to mark, and it was a very chaotic situation wherein no one was thinking about the patenting. But if you have some chemical which is having one specific use, and tomorrow if you come up with some new application of that chemical, so you can file a patent for that. But only thing is you have to justify properly. Really, it is giving you the another effect, and it is for another purpose only. So product, process, new applications can be filed under patent. Now, outer shapes, contours, configurations, that comes under design, industrial designs. I told you, no, you can just by observing the shape, you can find out Coca-Cola. That is there in presentation. I'm going to discuss that also. Now, if you have specific brand names or logos for your business purposes, and if you register that, that comes under circle R, complete circle, in that small r is there, and it is superscript. Okay, R. So registered trademark, that comes under registered trademark, and you have to register that trademark. You have to apply to specific agency, and you have to secure that trademark. Trademark, name itself indicates that it is for business purpose only. If you register that trademark, just like DMart, it has specific logo, brand name. Okay. Apple, it has typical logo. So if you register that, no one else can use that logo for the business purpose, and you can enjoy your legacy. So that has to be filed under trademark. Now, another part of the IPR, that is trade secret, the client list, formula of the product. See, there is classical saying that Coca-Cola, no one knows the formula of the Coca-Cola. That is true. That is true. No one knows because they kept that so secretly. Okay. So client list, formula, this kind of formula, secret formulas, that comes under trade secret. But no one registered that trade secret. Try to understand. It is for understanding. If you have this kind of data with you, so it has to be managed in such a way that it will be used for by you only. Okay. And if somebody is having specific creation of music, art, play, poems, so it comes under copyright. Circle is there, C in that circle, and it is again superscript, copyright. So that is your own right. So yeah, that is your own creation that can be used by you only. Unless and until you permit others, no one can practice that. So music, art, plays, poems. Okay, so copyright. So there are so many issues of the copyright. You know, somebody has having that quote matter. He has stolen my poem. He has stolen my songs, and that happens in Bollywood more times, more number of times. We have heard many stories about this music, art, and play stealing, where the copyright violation was there. Okay, so in that case, you have to pay a huge amount. Okay, so you cannot do it. You cannot actually steal the copyrights of others if it is registered. Unregistered music, art, play, poem, so you do not have a claim over that. It is something like public domain. So you have to register it under that copyright. Okay, so got it? Next. So now what is protected under what? This is the classical slide which will explain this. Even geographical indication is also there. So I am going to talk about that also. First of all, let us talk about trademark. Right side upper corner, you can see Apple. Okay, so Apple logo is there. So it is a trademark of Apple. They are using this logo for the business purpose. Every iPhone will have this logo, and no one can use this logo. If you use this logo for your business, so there will be a violation of trademark. So you have to pay a huge amount. Trademark. Even industrial design, fan, typical shape of the fan. Okay. Even typical shape of the Coca-Cola bottle. That is also a registered trademark. Industrial design. And the writing Coca-Cola, specific writing of Coca-Cola, that is a trademark. No one can have this kind of writing in a similar manner. You cannot do it. Okay. Now, the missing part in this is geographical indication. Now, I would like to talk about geographical indication. Geographical indication is what you can say is a material which has a unique feature of that particular region. It carries the unique features of that particular region. Or in another way, this unique feature belongs to that particular region. For example, Kolhapuri chappal. If you go to Kolhapur, you will get that Kolhapuri chappal. Kolhapuri chappal is now available at everywhere. No issue at all. But it is a typical indication. The shape of that and that registration is such a way that you can easily identify it belongs to Kolhapuri chappal. So it is very famous. And that geographical indications, actually, it signifies the locations. It indicates the location. Just like Tirupati Laddu. Tirupati Laddu is also registered under geographical indications. Another way of explaining this is just like Alfonso, Devgad Alfonso, Devgad Hapus Alfonso. If you if you consider the quality of the Hapus Alfonso of Devgad, Ratnagiri, Mangalore, Karnataka, if you compare this, there are differences in the quality, definitely. So, the Alfonso which belongs to Devgad, it has typical characteristics. That characteristics you cannot get in the Alfonso which is harvested and grown in somewhere else in the India. So that means what? It is a specific location characteristic. So geographical indication signifies the locations also. Okay. So now, is it clear? Next. Now, up till now, we know what to patent. Basically, what material can be patented under what sort of format that we know. IPR we know. Now, validity of IPR is very important. Validity. What do you mean by validity? The life expectancy, wherein that IPR belongs to you for that specific period. That is called validity. For patent, if you register any patent, let it be product patent, process patent, or anything, that patent will have a maximum protection of 20 years. That means what? For next 20 years after filing date of filing, say suppose today I file the patent, 3/7/2024. So now onwards for next 20 years, this patent belongs to me. Every year I have to renew that patent. I have to submit the fee on the same day. On the same day, you cannot pay in advance. On the same day, you have to submit the money, that renewal amount. And for next 20 years, you can only practice the patent. No one else can practice. Similarly, for trademark, it is a lifelong. And its renewal is after 10 years. For designs, maximum protection is not 20 years, 15 years. And for next 10 years, after 10 years, you have to renew it. Copyright is unique in this segment. Once you secure the copyright, it is for almost whole life, 60 years. Average healthy human life is 60 years. You can consider this. So copyright belongs to you throughout your life. Renewal is not required. That is another peculiar characteristic. And for GI indication, it is again lifelong. After 10 years, you have to register it. Okay, basically not register it, renew it. Now question comes that, sir, I forgot to pay the renewal fee, what happens? Up to 6 months. Okay, up to 6 months. Within 6 months of expiry of that particular year, you can pay the amount and you can what you can say revive the patent. But beyond that, this patent will be seized, that will go into public domain, and that patent will belong to public now. So no further rights of yours will be actually abolished, and that will belong to public domain. That means everyone can actually practice this. Okay, so you have to take care of renewal as far as patents are concerned. Now, what is the organizational structure? Because till this point, we were discussing about basic concepts. What is IPR? What are the characteristics? What is patented under what innovation belongs to what category, that we know. Now, next part is what is the handling authority of these patents? What is the hierarchy? What are the officials involved in this? So this is a small attempt to tell you about organizational structure of this patent, or basically IPR, not patent. Patent is one part, IPR. So organizational structure, if you talk about, so it comes under Ministry of Commerce and Industry Department of Industrial Policy and Promotions, where just like Drug Controller General of India, DCGI, just like in last lecture, you just recall, I talked about DCGI. In a similar way, there is one Controller General of Patent, Design and Trademark. Controller General of Patent, Design and Trademark. And that Controller General governs Patent and Design Office, Trademark Registry Office, Geographical Indication Registry, and Patent Information System. So Patent Information System, the office belongs to Nagpur. All over the India, the patent information PIS support is given by the Nagpur office only. Now, for patent and design office, in all, there are 4 offices all over the India, which are located at the 4 different corners of the country. One belongs to Kolkata, second belongs to Delhi, third belongs to Mumbai, and fourth belongs to Chennai. So these are the 4 regional offices of the patent and design, which covers entire country. Now, trademark registry. If you talk about the trademark registry offices, all these 4 regional offices, plus there is one special office in Ahmedabad, which supports the trademark registry, 5th one. For the geographical indication registry, there is only one office, that is Chennai office, where you have to apply. And for PIS, if you want to secure any information regarding patents and all, databases and all, that belongs to, that is in Nagpur. So this is a hierarchy and the locations as far as patent and design offices are concerned. Now, the core part of the patent. What is patent? How to define the patent? So patent is a grant of exclusive right, exclusive for you only. Okay, this is grant of exclusive right for which, for an invention, whatever you invented, for that it has to be given to you solely. Who gives you? By the government. Government gives you. To whom it is given? To the inventor. For how much period? It's a for limited period, like 20 years. And for this, what you have to do is, you have to exchange the full disclosure of the invention in exchange of. That means, if you disclose your information, this grant of exclusive right for your invention will be given by government to you for the 20 years. Now, the last point of this definition patent is, for which reason? To prevent others from selling, making, or using the invention. If you have that patent, no one can sell, make it, or use that invention. So these are the products which are invented. Actually, inventions are there which are registered. Okay, Canon has their own technology with camera. Diesel engines are there. Chipsets are there. You have ejection seats in the fighter jets. Even tablet capsules also. Okay. So now history of the patent. So patent, if you track the history of the Patent Act, because everything has to be governed by somebody or by something which is called Act. So Patent Act is very old, 1856. That was a British law based. So time to time there was amendment. After independence, 1959, Justice Iyengar report was submitted to the government, and in 1967, Patent Act bill was introduced. In 1972, the act came into force. That was actually passed by Parliament in 70, and that came into force in 1972. And from that point onward, there were amendments 94, 99, 2003, 2005. There were amendments in this act. So now what is patentable? Now next question comes in mind. Sir, we know these are the governing agencies. This is the Patent Act which governs all the patent. Now question is, how do I know my invention is patentable or not? Yes, of course. This is a very common question which is asked by you can say everyone who is practicing or who is doing research. So if your invention is novel, invention which has not been anticipated by publication in any document or used in the country or elsewhere in the world before the date of application, that is called novel. Novelty should be there. No one, you should be first one in the world, not even India, world. So then only it is called novel. First time. No one has that thought, no one has that documentation. Only you have that thought in your mind and documentation with you. Second, if your invention is inventive is what? Invention that involves technical advancement as compared to existing knowledge. It may happen, na? You may have some spare part, you modified that, now you have made it in such a way that carburetor or something like a vehicle part. So it has increased the mileage of the vehicle. So that is called inventive. So if your idea is inventive, again, inventive step, it is involved in your invention. So definitely you can go for patenting. And the invention which is having industrial applicability. So you say, sir, I'm not going for industry applications. I'm just going for patenting for my promotion and for. You can generate the patent, you can get the patent, but you cannot practice the patent. And patent itself is a very big affair of investments. Every year you have to submit the renewal fee. And after every year, there is slight increment in the renewal fee. So it is a very expensive affair. So it must have industrial applicability. Then only you can withstand with this patent. Otherwise, surviving with this number of patents and renewal fee, it is very difficult. So your invention must have industrial applicability. Got the point? So your patent, your idea is patentable only when it is novel, it has inventive step, and it has industrial application. That means simply, if you are doing some research, go for patenting only when if it has some industrial application. Otherwise, don't do it. Correct? Now, next part is, what is not patentable? You told us, sir, how to, what is patentable? I know. What is not patentable? So these are the classical examples wherein you cannot go for patenting. The invention which is frivolous means it's of no use. You are trying to develop something which is of no use, then that cannot be patented. Invention that is harmful. Do you have patent atomic weapon patent, hydrogen bomb patent? Have you seen? You cannot, because that cannot be patented. That cannot be patented. It is harmful to the human beings, animals, plant life, environment. So no one can patent it. Then simply you have some discovery, like mere discovery of or new use or new form or known substance that do not result in the enhancement of the known efficacy. You have something new, but it won't have efficacy. So that cannot be patented. Say suppose you have a molecule which is going to give you the antipyretic effect. So if you take that medicine within 2 hours, it will reduce your fever. But already you have in the market, there are so many drugs or APIs which reduces the fever within 2 hours. So what's the use? So you cannot patent it. Horticulture and agriculture methods cannot be patented because these are the inherent methods which are given to us by our ancestors. So that cannot be patented. One of the classical example I would like to tell you, in America, they tried to secure the patent of haldi, curcumin. So we were able to sorry, we were able to fight out for that patent, and we fetched that patent back to India. We told them that curcumin is used by the Indians since last 5,000 years. You are not the first one. America is actually formulated long after Indian history, basically civilization. So no one can claim rights for the curcumin, haldi. Okay, so that was the classical example. Any procedure, medical procedure, surgical, curative, prophylactic cannot be patented. You don't have patent like angiography patent. You cannot patent the angiography methodology. You cannot patent for ECG. ECG methodology cannot be patented. Methodology. Got the point? Mathematical formula, you cannot. Artistic work, including musical, dramatic, and literary, you cannot patent it, but you can copyright it. Okay, music, drama, literary, artwork, artistic work comes under copyright, not under patent. So if you tomorrow write a good poem and say, sir, iska patent kara ke do, it is not possible. Patent is not for that. You have to copyright it. Okay. Then topography of integrated circuit. Nowadays, Indian government has relaxed some of the rules, regulations in these circuits. So some of the portions now we can. But this is as per as Patent Act. Okay, that these all statements are as per as Patent Act. So that's why topography of integrated circuit is involved there. And atomic energy inventions cannot be patented. Now, types of the patents: design patent, utility patent, plant patent. These are the core types of the patents. But my dear participants, I personally practice the patents, formulations of the patents or filing the patents. I personally feel that it's my personal opinion. Na? Design patent is one aspect, process patent is another aspect, and product patent is yet another aspect. So I look towards this patenting in 3 different manners. For designs, it's a separate. Process and product, it's a separate. Okay. So for designs, ornamental designs, configurations. So I told you about the example of Coca-Cola, iPhone, and all. So design patents, industrial designs, that is covered for the contour or external shape. Okay. Any new invention, functional improvements comes under utility patent, and variety, asexually reproduced plant, comes under plant patent. But my dear participants, it is very difficult to secure the patents in the variety of plants because you have to work hard. It is not so simple because the thumb rule is you cannot patent which is naturally existing. Example, I cannot go for patenting of dogs. I cannot go for patenting of cats. Biological species which are on the earth since so many years. Okay. So naturally existing things cannot be patented, but the inventive application of the natural things can be patented. Okay. So there is a clear-cut understanding, demarcation line between the naturally existing things and its properties, innovative properties. Next, types of patent applications. So now next part belongs to the practical aspects of the patents. So what are the application types? So ordinary application is one. I am talking about Indian scenario, Indian patenting. So ordinary application is there, one type of patent application. Second is convention application. Next 3, 4, 5, 6 PCT international phase, PCT national phase. These two are international applications. Patent of addition is there and a divisional application is there. So now I am going to talk about more about ordinary, patent of addition, and divisional application. If you want to secure the right in India, so you can apply through this ordinary application wherein there are 2 aspects or two ways by which you can do is, once you get the idea, a little bit you worked on, and if you want to secure the right, go for provisional specifications. Little bit rough idea, you can go for patenting. After that, develop the idea completely, come up with complete specification and go for complete specification. So now question comes in mind, sir, if this is the case, provisional specification, why it is given in the act? Reason being, there are chances that so many companies, so many persons are working on the same idea. It may happen. Although, if you see the Indian scenario, everyone is working on anti-cancer development. So you may get the idea today morning, and the same idea or similar idea may come up in another's mind afternoon or evening. But priorly, you should be the first one. So provisional specifications will give you the right. First one first comes in the picture. Those who are having that first thought in their mind and those who applied will have a right. So simply provisional specification is given. Now I will talk more about patent of addition and divisional application. Say suppose you patented some idea or some process or product, and tomorrow you thought that there are some improvements, modifications. So you can go for patent of addition. So previous patent will be there. You can add something. So that comes under patent of addition. Now, another case, if you have some patent with you and now you want to clarify something through patent, so you can register divisional application. So that comes under divisional patent. It will be a divisional patent of original patent, which will explain more about the invention. And that specifically pharmaceutical industries, they go for this patent of addition and divisional applications, wherein more clarification. If someone actually inquires, someone raise a query, so you can have the answers with patent of addition and divisional applications. Now, the patent application stages. What are the stages of patent application? So there are classical 5 stages. First, you have to file the patent, then it will be published. Third, there will be examination of this patent by patent office. Fourth, if somebody is having objections, there will be opposition to that patent. And fourth, there will be grant. So these are the classical 5 stages of patent applications. Now, another part, sir, before going for filing, what are the requirements? What are the requirements for the patent filing? So type one by one, I would like to talk about this. First of all, any person, first inventor or assignee or legal representative, he or she can apply for the ordinary patent. So what means, either you must have one person or a organization. Both can apply. A person can apply as a natural person or organization can apply. Okay. Second, what are the types of filings? Physical filing and online filing. Physical filing is specifically made in a blue color and italic because right now this physical filing is abolished. Last so many years, now we are into online filing where no single printed document goes to patent office. You have to file it online through, just by sitting at your home or office, you can file the patent. Do you know? This is online filing procedure, and one of the best sites I ever seen. Indian Patent Office has one of the best sites. Only thing is you must have some technical knowledge of handling the digital signatures. Indian Patent Office, I really admire their efforts. They have given clear-cut instructions. What should be the settings of your laptop? What should be the settings of your computer before starting the filing procedure? See the depth they are having. Okay. Then where to file? Yes, these are the 4 different offices. Territorial jurisdiction is there, but it is online. So if I apply from this Maharashtra region, my application may not be entertained by Maharashtra region office like Mumbai. It may be entertained by Kolkata, maybe Chennai, maybe Delhi. And this is always a crisscross. The application which belongs to particular zone is not handled by the particular regional office. It is given to somebody else. Last, I have 3 patents. I'm going to show that. So all these 3 patents were handled by other than Mumbai offices. So you can judge. So now what is the requirement? You must have a Form 1 application for the grant of patent, where you have to give the details of applicants and all. Form 2, where provisional and complete specification has to be given. Form 3 should be there, which will have statement and undertaking. Form 5 should be there, declaration of inventorship. We have to declare we are the only 5 inventors. No, nobody else is there. So you have to declare. So first will be Sachin Bhusari, second will be Dr. Praveen Okte, third will be, this should be the sequential way of declaring the inventorship. Then Form 9 should be there for request for publication. Form 18 should be submitted for request for examination. Form 26 should be there. And beyond that, you must have certified copy of convention application if you want to apply for foreign countries. Apply abstract of invention drawings. Fee is online paid. And the most important critical part of filing is digital signature. There are 2 types of signatures, class 2, class 3. For the patent filing, my dear participants, class 3 digital signature is mandatory. I repeat, class 3 digital signature. Now application form. This is just like Form 1, which looks like these are the corners of the forms where you have to fill the information. Okay, filing date and all those things. Ordinary application, applicant name of the applicants, house number, address, everything. You have to fill the form. Form 1 will look like this. You have to fill the form, online form. Huh? It's online available. So you have to fill the form online. Now, I told you about the provisional specification and complete specification. I am not going to waste much time because we have only 15 minutes left. So it should be filed as soon as inventive idea comes in mind. Okay. Invention and details should be described, but claims is not a mandatory part. Because in patents, do you know what you get? You get the claims. In patent, the thought of common man is, if I get the patent, that means I get a certificate. That is true. But that certificate belongs to some claims, technical claims. That claims are granted to you, not a certificate. Certificate is there. But that claims are, which are the mandatory part of your invention, that are granted to you. Okay. Now, content of provisional specification, type, title, written description, drawings. Okay. And sample and model. I'm not going to discuss about the provisional specification and advantages. You get the priority. Those who are going to register the patent, register for the patenting, they get the priority. And once somebody registered the patent, then you cannot, because it will be denied, simply denied. So priority is very important. You get extra time. Once you prioritize, you get the extra time for the development. And then you may get, once you secure the right, then you can disclose the information to other persons. Because now rights are with you. Priority is there. So you can disclose the information to the companies and you get the beneficial support. Okay, commercial feasibility is quite possible. And further expenses you can avoid. Okay. So now what are the contents if you want to completely submit the complete specification? Title of the invention. Gray areas. There are 3 colors. Okay. So gray areas are there. This is conventional process. Okay. One of the light blue and green. So you have to focus on these light green areas. So first is title of the invention, where you have to construct a title, just like our research paper. You have to construct a title. Then second is field and background of the invention. You have to write in a simply lucid manner. See, you have a limitation of only 40 pages. Beyond 40 pages, if your invention exceeds, for per page, you have to pay extra amount. Okay, keep this thing in mind. It's not so simple. It is not so simple. You have only 8 to 9 claims. Beyond that claims, for every claim, you have to give the money. It is a commercial affair. It is very commercial affair. Okay. Now, next part is use of the invention. See this green area, use of the invention is very clearly defined. You must have very short information about this. Even object, aim of the present investigation. Why you are doing it? Why you are going for patent? You have to write it here. And last is claims for legal monopoly. That 3 boxes, focus on these 3 boxes. For your patent filing, you must have a very clear information about this use of invention, object and claims. Rest comparison between prior art, present investigation, prior art and their drawbacks. Then again, summary of the present investigation, statement, detailed description, working examples, and abstract. So I would like to talk about prior art. Technical word is there, prior art. Prior art means the information which is similar to your invention, which is available, existing literature. Then you have to show that there are drawbacks. That's why this invention is more important. Okay, so this should be the complete specification. So now, if somebody applies for the patent, so there are chances that somebody may oppose to your patent. It may happen generally in academics as well as industry, wherever both the cases are there. See, can you recall one case? Samsung used some patented technology of, I think, iPhone, Apple technology. So Apple fought that in the court, and Samsung has to pay, I think, huge amount, so fine against that, and that was a matter of patenting only. So if it surfaces, if it pop-ups, you have to pay. Second, if you want to oppose that patent, so at what time you can oppose? During the patent filing and the process, granting process, you can oppose, or else after grant also, somebody tomorrow may claim, na, sir, I haven't come across the patent, just now I saw it. So this is my work which has been stolen by my colleague. So after approval also, grant also, you have 1 year period within which you can oppose. Now question is, why to oppose? And in what cases it is opposed? Patent, if you are wrongfully getting the patent, so patent will be opposed by somebody else. If your patent is obvious in nature, again it will be opposed. If it is not, claims and invention is not matching, so you can oppose the patent. And basically, complete specifications, if you want to write, okay, so don't go for that provisional specifications. Complete the study and then go for it. Otherwise, some lacunas may lead to opposition. Okay. Now actions. See, if you are individual entity, your fee structure is small, a little bit small segment. If it is a legal entity, it's a 4 times. So while filing, if you have 30 pages and maximum number of 10 claims, 30 pages, not only 40, it's a 30 page. So you have 1000 fee. For additional sheets, you have to pay 100 fees, 100 rupees per page. And for each claim, you have to pay 200 rupees. And for legal entities, it is 4 times. Request for examination, 2500 rupees. Request for early publication, 2500. So this is the amount. So I purposely wrote it here because you must know while filing the patent, how much difficult it is to manage the patent while processing as well as after patenting also. It's a commercial one, no? Commercial one. So now patent filing procedure in India. So if you file provisional patent, you have 12 months to file a complete application. Within 12 months, you have to. After that, 18 months, this patent will be published on website. Now question is, sir, it is my invention. I have handed over that information to patent office, and patent office is basically publishing that document. This is nonsense. No. If somebody has already issues, claims, oppositions, so everyone must have a fair chance. So this patent it is published online and it remains published for 18 months. If somebody have objection, you have to take that objection in this 18 months. After that, there will be request for examination from your side, from the inventor. We have to file a form. I showed you form 5-6. You have to apply. Then there will be first examination report of your patent within first 6 months. You have to reply that. If you comply that reply nicely, then it will be go into grant and you will get the grant. If not, there will be second examination report. Again, you have to reply. Compliance is there, there will be grant. If not, there will be hearing in the patent office. My dear participants, technically, it is after second examination report. But practice is, in your first examination report, there will be something like call conference or video conference. And in call conference or video conference, you have to justify, you have to submit the compliance. Okay. And if it is in line with the patent office, then only the patent will be granted. Otherwise, it will be simply denial. Okay. And now this yellow bracket, process expedited since last 2 years. So this process, all this process, it takes around 3.5 years, right from start of your submission of application till grant. It is something like 3.5 years. But now last 2 years, process has been expedited. So within 1 year, 1.5 year, you have that great chance so that you can get the patent. Okay. So if you complete this process, then it is granted and then it is labeled like patented. So now how the patent will look like? This is the classical way of patent. See, this is the patent certificate wherein you can get the information. Patent number is there. This is a unique number. Application number will be there. Application number first 4 digit 2017 2017. So it signifies the year of application 2017. Then file करने के date, see 24/4/2017. Who is patentee? Sachin Shivling Bhusari, applicant and the first inventor. Okay. And now it signifies the next 20 years period in the patent. So you can see, you can read it. The signature is there, patent attorney signature is there, seal is there, Government of India. And this certificate, it signifies that you get that patent of claims, that claims you submitted in the patent office. Okay. So this is the overall procedural part about the patent. So I hope within time frame, I am able to finish this overall scene of the Indian patent. It's a journey, or you can say pathway from theory to practice. If you want to submit the patents, I'm sure some of you may have questions in your mind. I'm going to answer that questions at the level of my best. So beyond that, now I would like to share some of the capabilities of my department where we do share or we do support the researchers. This is a commercial slide. This is with permission of my university. So I do have Center for DMPK Studies in my department. So we do offer services of analytical services like HPLC, LCM-SMS, GCM-SMS, ELISA plate reader, UV visible spectrophotometer, and we support in antioxidant assays, purification of phytochemicals, isolation of phytochemicals, and method development and validation. And I got 3 patents, granted patents, which belongs to my department. Basically, it is quite possible because of my department, my university, and my the then vice chancellors and today's existing vice chancellor. They are supporting us. The university official supports us. So that's why it is quite possible for a person like me to practice my inventions, to file the patents, to secure the intellectual property rights. So I used to offer services through this Center for DMPK Studies. If somebody needs some support from this domain, so you can contact me. So this is my email ID. So official email ID is bhusari.kemtech@bamu.ac.in. One of my personal email ID is there, sachinisbhusari@gmail.com. So this is the overall scenario as far as patent is concerned. So somebody from your side, if someone is interested to know more about, so now we will take question session from this point onwards. So once again, I am thankful to Director HRDC, then HRDC, now Madan Mohan Malviya Teachers Training Center of the university, Dr. Patil sir, Satish Patil sir, Assistant Director Dr. Rafe sir's team, Gaurav, and all colleagues. So thank you very much for giving me the opportunity to deliver these lectures at your center. And thank you very much for giving me an opportunity to share my views about human health as well as the patenting. So now onwards, now point onwards, I would like to take up question session for the Indian patenting. Thank you. Dear participants, कुणी आहे का लेक्चर मध्ये?
हो थँक्यू सर.
थँक्यू. कुणी बोललं नाही. आय थॉट आय एम द ओनली वन इन द लेक्चर. सो इट इज नॉट द केस. It's good
Yes,
one.
sir. Thank you so much for nice session. This is very nice. Roll number 13, are you, sorry, 14, are you there?
Yes, madam.
Sir, please propose the vote of thanks.
Okay, madam. Okay. Good afternoon. Myself, Dr. Suryavanshi Dhammapal Nyandev, roll number 14. First of all, I am thankful to our Director of HRDC, Dr. Babasaheb Ambedkar Marathwada University, Chhatrapati Sambhajinagar, for providing me an opportunity to express the vote of thanks. My special thanks and gratitude towards our eminent speaker, Dr. Sachin Shivling Bhusari sir, who delivered very nice and wonderful lecture on the topic of aspects of human health, past and future. Sir nicely differentiated the various faculties such as allopathy, Ayurveda, homeopathy, naturopathy. Sir explained diagnostic methods used in those fields. Today, we got valuable information about various diseases, their prevention, and recent development in drug discovery, various patent. Thank you, Bhusari sir, for your valuable guidance. I pay my special thanks to all the participants of this course. I express my thanks to the technical development of this online FIP course. Once again, I thanks to all. Thank you, sir.
Thank you. Thank you. Dhanyawad. Thank you.
Sir, could you share this information to us?
Yes, definitely. I am going to
Thank you.
share. No issue at all.
Yes, sir.
You can
Okay,
get
sir.